Hello, 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 everybody. Jill Osborne from the Interstitial Cystitis Network. It is Sunday, July 2nd of 2023, and it is time for another drop-in support group meeting. Now, it is here in the United States, 4th of July weekend. This is the Independence Day weekend, so we may not have a lot of people today. That's okay. When you guys are done, I'm done. I will go as long as you want me to go. Now, my purpose in doing these meetings is to make you so strong, so knowledgeable, so informed that no one can mess with you. I have to get comfortable here. Hold on a sec. I want you to walk into your doctor's office knowledgeable, informed, educated, ready to engage in a good discussion about your treatment. I want you to feel confident. I want you to feel empowered, and I want you to be able to look that doctor in the eye and get the help that you need and the help that you deserve, because there is no shame in having this. Interstitial cystitis is real. It is treatable. And many of you may be stunned to find out that we no longer think of interstitial cystitis as a bladder disease. We think of interstitial cystitis as a pelvic pain syndrome. Why? Because structures outside of the pelvis are often involved. So we don't find a disease process. Hi, Christine. We don't find a disease process happening in the vast majority of IC bladders. Rather, for most of us, it's a neuromuscular disorder. So today, rather than throwing bladder treatments at people, we don't do that anymore. What we do instead is take a step back and do a much more precise diagnosis. We're not going to assume you have UTI. We're not going to assume you have an incurable bladder disease. Rather, what we're going to do, hi, you guys. What we're going to do is try to get to the underlying cause of your symptoms. We're no longer going to chase your symptoms. We're going to focus on underlying causation. What could be the cause of these symptoms that are driving you batty right now? The frequency, the urgency, thank you, the pressure, the pain. You're not sleeping at night. You're sleep deprived. Some of you are afraid to eat. Some of you are afraid to leave your home. Some of you are afraid to get in the car. I understand that. I have been there completely, totally. You are not alone. But we now have a much better idea of why this is happening. And best of all, we're treating it more effectively. Now, you guys here on Facebook, people are coming in and out. Let me just check my settings here real quick. No, I have my audio, so you should be able to hear me okay. All right. Well, it is what it is. It is a holiday weekend. Now, so what's happening in the ICU world? We have a lot of really good conferences that I'm going through right now. We have some fascinating new research that is giving us a little bit more insight into what could be one of the many potential triggers of your symptoms. And again, the goal here is to try to find your underlying cause. Hi, Donna. Hey, girl, how are you, hon? How are you? How is life? If I'm seeing a common theme here in my office, I'm seeing a lot of pelvic injury. I'm seeing a lot of pelvic trauma. I was working with a lovely gentleman over in Ireland. And I always say when I work with men that, 90% of the time, 95% of the time, we usually can find a trauma. And he's like, didn't seem like trauma at first. But, and he, like me, had gone through, he just lost his mom. And so that grief is real. But in the end, he was a bike rider. He had been riding bikes for a long period of time when he was younger. And all that sets the stage for pelvic floor dysfunction later in life and interstitial cystitis later in life. We had one research study years ago done by the American Medical Association, which showed that for men, if you as a young boy jammed if you jammed your crotch on the bar of a bicycle even once, that by the time you'd be in your 30s or 40s, you'd have frequency urgency. Why? Because of that injury. So we're just continue to see lots and lots of injuries. And then the other thing that we're seeing, and I'm thinking very specifically about a patient that, I mean, this is happening almost every day. Remember with our subtypes, so we've got Hunner's lesions, we've got bladder wall driven from chemical injury, we've got bladder wall driven from estrogen atrophy, we've got pelvic floor driven, we've got pudendal neuralgia, and we have central sensitization widespread pain. So these are the people who have IC, IBS, vulvodynia, etc. And I'm in this group, and I, frankly, in my 20s felt completely lost and alone because I just felt like I was having health problem after health problem after health problem. While my friends were out getting married and having babies, I was laying in the bathroom having bowel spasms from IBS. So I was working with a woman on Friday who presented immediately with widespread pain. So she had the IC, she had fibromyalgia, she had a wicked sense of smell. Donna, we'll come to that. Donna, I want to know more about. Oh, for God's sake, I want to know more about that. Okay, so she has this wicked sense of smell. Her husband was teasing her because her sense of smell was so bad. And as soon as she said that, I knew she was subtype 5. She had extreme skin sensitivity, just like me. And so we're kind of going through the subtypes, and she was extremely pelvic floor driven. There's no doubt about that. And she was extremely nervous system driven. And so we go back in time, and it's like, okay, well, hon, did anything happen to you? Can you remember any trauma? And when she was young, she had a massive tailbone injury that had her in bed for months. And that's what set the stage. So, and we still don't know. She still doesn't know if her tailbone has healed in the correct position. And it's 40 years later. But almost immediately after this injury, she started struggling with very, very tight pelvic floor muscles. Of course, she was diagnosed with interstitial cystitis. She was still using Elmeron even now, which is like mind-boggling. And in the end, we gave her a completely different way of looking at this. It's like, okay, so you are absolutely a trauma patient. There's no doubt about that. You had a massive pelvic injury. She's like, yeah, I did. Absolutely. And we know that 14 days of pain will put the brain into a constant state of fight or flight. We know that. That's what pain does. That's your brain is trying to save your life. When you're in pain, your sympathetic nervous system is going to take control and do whatever it can to try to save your life. So she developed anxiety disorder very quickly after that injury. And then she had these progression of other painful conditions. So she had the bladder pain, then she had the fibromyalgia, then she had the migraines, then she had the TMJ, all from that original tailbone injury. And so therapeutically then, what are we going to try to do? Now, this is what she knows. Bladder therapies never worked. Elmeron never worked. And it's like, why are you on Elmeron? You have a completely normal bladder because, hello, her bladder is entirely normal. They looked at it. It was normal. So why are you doing bladder treatments? And she's like, I'm not really sure why. And I was like, okay, well, this is going to be an important discussion with your doctor. Okay, have you had a pelvic floor assessment? She hadn't, but she's going this week because she watched several of our videos, and that was awesome. And she had the classic symptoms of pelvic floor driven, which is, not being able to urinate right away, sciatica, pain that might shoot down a leg, pain isolated on the left or the right side of the pelvis, whatever. So we know that physical therapy is incredibly important in that circumstance. But then the other thing that we have to do is we've got to calm that central nervous system down. And we went through our classic I SPY technique. And this is where mind-body medicine is so important because it can reduce the overall stress from that original injury that's keeping that brain wired up. And the more wired you are, the more stressed you are, the more intense the pain is going to be. We've got to calm everything down. We have to calm the nerves. We got to calm the muscles. So I'm very optimistic about her future. And I think that her mind is going to be blown about how the health of her muscles. I think her muscles are probably toast because I think her tailbone is still injured or at least healed out of position. It'll be very interesting to see what she sees. So that's a real classic phone call that we get here at the IC Network. Um, we get a few patients who call a week, not a few, actually several a week with Hunner's lesions. But for the vast majority of you, we're really looking at neuromuscular issues. That's what's going on. And so that's very exciting because now we have the right treatments. I did a quick drop-in support group meeting here on Facebook. Right now, we're live streaming on YouTube and Facebook. So if I'm looking over there, that means I'm looking at YouTube. And if I'm looking here, it means I'm looking at Facebook. We figured out the problem last week with the connection. So Facebook, you should have YouTube, you should have a really good connection now. Should be no fuzziness at all. I am writing our next magazine. And the article that I've just finished is an article on artificial sweetener. Because when you have an injury to the bladder and you have a wounded bladder, whether it's ischemia from tight muscles, estrogen atrophy, Hunner's lesions, etc., your bladder wall is unable to protect itself. It has the equivalent of wounds in the bladder wall. And so this is why diet is important. We've got to create an environment that will support healing. Oh, I got to say, I talked to 2 patients last week. Boy, did they love their coffee. It was amazing how much they love their coffee. Heartbreaking for them to stop their coffee. Okay, but anyway, diet matters. Diet really matters. If you have a wounded bladder and you poured acid on the wound every day, are you going to get better? No, your bladder's not going to heal. So we learned very, very early on that artificial sugar was absolutely devastating. NutraSweet is so irritating to an IC bladder. It's ridiculous. Hi, Bonnie. Nice to see you, hon. I hope you're doing well. So, we knew that drinking a Coke was bad, but drinking a Diet Coke was even worse because NutraSweet is metabolized into formic acid. Hello, acid, really irritating to the bladder. And also formaldehyde, which, hello, is a carcinogen. So, we've always discouraged diet soda. A couple of things happened in the last week, though. The World Health Organization has now put NutraSweet on their carcinogen list as a known carcinogen. And this is a month after they actually just issued a broad recommendation that nobody use any artificial sugars. Hi, John. Hi, John. So that's really good that now we have the World Health Organization saying you shouldn't be doing any artificial sugars, any. The only exception they made was sugar alcohol, like erythritol. And we have a lot of companies now that are using sugar alcohol for their diet stuff. And interestingly, the Cleveland Clinic just did a study which showed that sugar alcohol can cause blood clots, which can increase your risk of stroke and heart attack. So I love being able to be the consumer reporter of the IC Network. And so if the World Health Organization is saying no to all artificial sweeteners, so is the IC Network, and especially the sugar alcohols, and the NutraSweets. So I think you guys know, because I had COVID a month ago, that I had started drinking lemonade again. And again, because I'm not bladder wall driven, I don't have Hunner's lesions, I'm pelvic floor driven. I was thrilled to see that I had no problems drinking lemonade. So I've been drinking it for a month, and then I've been slowly watching my stomach get bigger. Even though I've been walking massively, it's like this morning, I'm like, where'd that stomach come from? Oh my God. And then it's like, oh my God, Jill, you're drinking soda every day. It's just in the form of lemonade. So I dumped out the lemonade. No more lemonade. My goal is to, for the first time in 15 years, to eat a really good diet. And so the sugar is gone. I'm going to have chicken and vegetables for dinner tonight. Anyway. So you guys, do you have any questions? How are you doing? Hello, Anne. How are you? And Donna says, She's dealing with the aftermath of her hospitalization. Your nerve pain is worse than before my infection. Vulvar pain is worse, nerves on overload, keeping in touch with my gyne on a regular basis, gabapentin and oxytocin. Now, interesting. You're on estradiol, low strength. I need to call you, Jill. I also have a mild thickening in my bladder wall. Well, you know what we can do is we can go into Zoom if you want. We can go into Zoom in a little bit. I don't have a problem doing that. I've kind of fixed this computer, so now I can more easily go into Zoom. And you know, Donna, I mean, honestly, I think that I mean, we're in my family, we're experiencing now the cumulative toll of profound stress and grief. As I was walking this morning, I was going, you know, I used to teach stress management classes for the Small Business Association. I used to actually run a small business office for them right after grad school. And you always used to say the most stressful thing that you can ever go through is the death of a family member. And I had never gone through that until recently. So in my family, it's interesting to see the ripple effect on everybody's health. So my brother-in-law has pneumonia now. My sister is dealing with that terrible cold. I'm getting over that terrible cold. And it's just, so yeah, I'm glad they do, Donna. Donna lost her son, and I lost my parents. So it's interesting. It's you know, it's very, very new. I'm tomorrow is his birthday, so you're supposed to do exactly what he would want you to do, right? We have to, and so sometimes the best way you can honor somebody that you love and lost is to think about something that was important to them and do it. Whether it is buying some food and taking it to a homeless shelter, or just going out on a picnic and being in the sun, or taking a hike. Yeah, exactly. My birthday is on the 12th of this month. And because everybody's really sick, I've already told everybody, let's just push it off for a month or two. Thank you, Heed. Thank you very, very much. The best gift I can ever have for my birthday is I want to hear people laugh. I just want to play games. I just want to play games and hear people laugh. Let's have some popcorn. Let's get up Monopoly or play poker or something, or badminton, or go bowling or go miniature golfing. I just want to play games. That's all. It really changes everything. You know, you don't care, like I don't care about a fancy car or anything at all like that. We have a very big IC conference happening next week. We're going to have a lot of new news from that. I am not going to that conference because I am still getting over my cold. And the worst cough of my life. I mean, I'm doing well, but I didn't do my meeting a week ago. But we've got some other patient advocates that are going to be there. So hopefully I'll be able to get some good reports from that IC conference. Other than that, we've got some big clinical trials that are recruiting over on the IC Network website. A clinical trial is a great opportunity for you to work with some of the best doctors in the world for free and get treatment for free. And so if you feel like you're not working with an educated, informed doctor, if you feel like you're not responding to therapy and you just want to get a new perspective on this, if you want a second opinion, a clinical trial is a really, really good place for you to go because it's free care. And we've got some kick-ass clinical trials going on right now that are very, very exciting. Peggy says, hello, Jill. Thank you so much for yesterday. You're very welcome. You know, guys, I was working yesterday. I've been working on the IC Network website, and I always say I've got a little angel sitting on my shoulder. And every now and then on a weekend when I'm not working, I hear the phone ring and that little angel whispers to me and said, you're supposed to answer this phone. And Peggy called yesterday and we had a delightful conversation. You made my day, Peggy. So I really hope that I helped. I really hope that I helped you, hon. And you are not alone. You've got this great community of people who send you lots of good vibes. And like I said yesterday, sometimes the most important thing you need to hear is that aside from the fact that you're absolutely not alone, it's so cool to talk to somebody else who has this, who's been through this, but that there's nothing alarming about your case. And for 98% of the people who call, there's nothing alarming. Now, I will say that I was working with a patient on Friday who had not been diagnosed with IC, but she was bleeding every week for a couple of days. She had gross hematuria. She had visible blood in her urine. It had been going on for like 2 months every week to the point that she was getting anemic. And of course, the doctors go in, they rule out infection, they rule out cancer, because whenever you see, if you see visible blood in your urine, that has to be checked. When do we commonly see that? We're going to see that with a UTI. We're going to see that with a Hunner's lesion. And we're often going to see that with bladder cancer. And so our guidelines are very clear now that if you're in the process of being diagnosed, but you have any visible blood in your urine or even a lot of microscopic blood, they want to do a proper workup for that. Let's make sure that you have a urine cytology test, which is a simple urine test to see if you've got any cancer markers. In her case, they went in, they did a cystoscopy, and they looked in her bladder, and they found nothing. Nothing. And she was bleeding the day before, and they found nothing. And it's like, well, she says, Jill, I don't know what to do. I mean, I'm bleeding. They've seen me bleed. I'm almost anemic from it. Yeah, and John said, and with kidney stones, exactly. And in her case, she had a swollen ureter, which is the tube that goes from the kidney to the bladder. I think that was the only thing that was unusual about her case. Oh, and she had a ovarian cyst. So, I mean, this is where we have to be very assertive. And I have two very clear rules for me personally that I normally follow. And that is, if I'm bleeding and the bleeding doesn't stop, I want somebody to look at it. I'm not interested in guessing. If I'm bleeding from my vagina for weeks and weeks, as I did 7 years ago, that turned out to be early uterine cancer, for God's sake, you have to let somebody figure out what's bleeding. And again, in this patient's case, I'm like, if I were in your shoes, I would certainly be asking for a hydrodistension with cystoscopy to take a closer look at your bladder wall to see if we could figure out where you're bleeding from. And then perhaps some kidney tests to see if maybe you're bleeding from your kidney. So rule number one is, if you're bleeding and the bleeding isn't stopping, you got to get somebody to look at it. And rule number two is, if you're in pain and scared, don't sit at home and wait. You've got to be bold. And again, if I'm in pain, I want somebody to look at it to help me understand why I'm in pain. What is going on with this? And I learned early on in my 20s that the longer I waited, the more stressed I got. And then I would be under stress for weeks and weeks and weeks and months and months and months for something that turned out to be a nothing burger, right? Now, I will confess that just like you guys, I have my own issues. And I was diagnosed with high blood pressure last fall. I'm on meds. I lost weight. I got rid of salt. I got my blood pressure back to normal. And the cardiologist was thrilled. The doctors were thrilled. Everybody's happy. They all went, you don't need meds, except for my primary care doctor, who said, high blood pressure is a silent killer. I want you on meds. And I'm like, but everybody says I'm good. And she's like, I want you on meds. I'm worried for you. And because I was caring for my parents and it was very stressful and it's fire season, I'm like, okay. So I've been on a low dose blood pressure med. The problem is I'm now afraid to take my blood pressure. I was taking it every day. I took it every day for 2 months, gold. Fine. I have it. I still have it. It's good. And then she wanted me to take it once a week. And what happened is when I took it once a week, I stressed out about it. It's like, oh God, what is it going to be? Is it going to be better or worse? And I didn't give it, I got too stressed. And I've been on the phone with my doctor crying about it. It's like, why am I so freaked out about taking my blood pressure? And she goes like, Jill, you're under a massive level of stress. It's okay. Give yourself some grace. So I'm going to go in September and have them. She goes, for somebody like you, we would take your blood pressure once a year. So I'm going to go in September. I'm going to give it 2 more months because the stress of my parents. I'm walking every day. I'll have them take it in September and we'll see where we are. So we all have our things, right? Donna says, I bought Bladder Builder, but my cystoscopy showed a normal bladder wall. What supplement do you recommend to promote good overall bladder health? Bladder Builder is, in my opinion, the best supplement on the market. I believe that it is because it has the most methods of action. It has more ways of potentially helping. It's got the chondroitin for the bladder wall. It's got quercetin for the antihistaminic effect. It's got good beneficial probiotics for the gut. And most importantly, it's got PEA, palmitoyl-ethanolamide, to calm nerves down. And so if you're tolerating the Bladder Builder, I think that the Bladder Builder is really it's the best supplement on the market for what it does. But maybe instead of taking 4 a day, you can just take 2 or 1. Hi, Renee. Why don't you go down to 1? I mean, well, the big question is, will I have to be on this supplement or this med for the rest of my life? And the answer is usually no. You just have to figure out if it's helping you or not. So how do you figure out if it's helping you? Well, according to Dr. Lowell Parsons, who invented Elmeron, when somebody asked him that question, he said, just reduce the dose. So if you're taking 4 a day, go to 3. If you're taking 3 a day, go to 2 and see if your symptoms change. If they don't get worse, then maybe it's not helping you. Go to 1, see how you do. Slowly work your way down. So, when I was taking the bladder wall supplements, now I have a healthy bladder wall, so I'm not doing that anymore. I only took 1 a day, and that was fine. When I went to 2 or 3 a day of Sister Protect, it gave me a loose bowel. But now we have newer supplements in Sister Protect that I think are tackle it in a different and perhaps more effective way, like Bladder Builder. Now, the other thing that I think is emerging that is going to become critical for us is to make sure that we're taking a good probiotic. Why do I say that? During the AUA meeting this year, and Denise, hold on. Denise said she sent a sympathy card weeks ago with a note you sent for your dad's birthday. Oh, it was returned. Yeah, you know what? I canceled that PO box. I did. So, Denise, I can give you another address. I can give you my home address, okay? But I will whisper it to you. Okay, sounds good. So anyway, at our AUA meeting, we had just probably one of the most fascinating, most thoughtful, most responsive studies that I've ever seen. And it was done by Dr. Ann Ackerman down at UCLA, who was talking about the urinary biome in the IC patient. Now, you all understand that our body has trillions of good bacteria throughout our entire body, from the tips of our toes to the top of our head, from our skin to our bladder, to our bowel, to our mouth, to our nose, to even our brain. There are beneficial microbes living throughout our body, which play really important roles in our health. They produce food, they kill bad bacteria, they help our nerves function better. Beneficial bacteria are critical to our health. And now that we have DNA testing, right, and they've gotten much, much better at studying the biome. So we have a much better idea, for example, of what's driving bacterial vaginosis. We know that dysbiosis, which is a disruption of the biome, is now linked with many severe diseases, including cancer. So there's a growing body of research that's helping us understand that when our biome is damaged, illness happens, injuries happen, trauma happens. So up to her research, the researchers that were looking at the urinary biome in the IC patient, they were looking for the smoking gun, Helicobacter pylori, which is the cause of stomach ulcers. They were hoping for something like that. They didn't find it. What they found consistently was a healthy biome that was a little bit less diverse, didn't have as many of the good bacteria, and with a little bit more than normal lactobacillus. Now, to me, that makes total sense, because if there's ever a population of patients completely overexposed to antibiotics, it's us. Because every single one of you, myself included, we all thought it was infection. We all took antibiotics, in some cases for years. So there's going to be a toll that's going to take on our biome. So that kind of makes sense. Not as many good bacteria. That could be explained by that. So the general consensus among multiple studies, because multiple studies came to the same conclusion, was our biome was normal. But Dr. Ackerman is remarkable, because she was intrigued by that. And she happens to be a biome specialist. And so she decided to take her own look at the biome of the typical IC patient. And in her study, she found at first exactly the same thing. She tested the urine of lots of different IC patients. And what she found was an overabundance of lactobacillus and not as many good bacteria, but otherwise it was pretty normal. But that's when we got to be a little bit more intuitive here, because we know that our biomes can change over time. And we really know that in women who have gone through menopause, because when you go through menopause, you become more acidic, that you become more, and you end up with more diverse bacteria and more, you just become, you're not out of balance. It's just your biome changes and you start to have more than you did before menopause. So she was the first to look at this IC data by age. So she looked at people under the age of 45 and over the age of 45. And what she found was absolutely stunning, that people under the age of 45 were less diverse and had an overabundance of a specific lactobacillus called Lactobacillus iners, INERS. Now, up to this point, most of the biome studies never found a Lactobacillus iners, because it turns out it's really hard to culture. It takes a blood agar plate. Literally, it eats blood. So they've developed new techniques in like the last 5 years or so that have helped them identify this wolf in sheep's clothing, this Lactobacillus iners, that it turns out is common in people who are sick or who are becoming sick. Like bacterial vaginosis, Lactobacillus iners becomes dominant. And the problem with Lactobacillus iners is that it's not a good lactobacillus at all. It doesn't kill fungus. It doesn't produce lactic acid. It does not do any of the key tasks that something like Lactobacillus crispatus, which is the most important good one. You compare the two, patients who are dominant in Lactobacillus crispatus have a good long-term healthy outcome. Patients who are dominant in Lactobacillus iners are far more associated with disease. So she's the one who looked at this overabundance of lactobacillus and found the lactobacillus iners. But then she took it a step forward. I mean, a step forward, and looked at her data based upon subtype, which is exactly what we needed. Because what she found is that patients who are pelvic floor driven have completely normal biomes. They do not have any lactobacillus or if they do, it's controlled. People with pelvic floor dysfunction have a perfectly healthy, good biome. People who have bladder wall sensitivity were dominant in Einers. The other problem with Einers is that it has what we call a bactericidal effect. It does something that bad bacteria does, and that is it breaks cells. So, and it's all about, I was reading some of the research, and it's, when you think about good bacteria and bad bacteria, you have to remember that they're parasites, but they're good parasites. So if you think about a tapeworm, for example, a tapeworm is a bad parasite. If you're unlucky enough to get a tapeworm, it burrows its head into your stomach or into your bowel, and it takes blood and it feeds itself. And then finally it sheds off sections of the tapeworm. Hopefully you see it. You go to the doctor, they give you a med that kills the tapeworm. But the tapeworm lives off of the human body. Well, so do this beneficial bacteria. And so lactobacillus iners, for example, is not killed by flagell. So if you've taken flagell for bacterial vaginosis, they've proven that the flagell will not kill it. In fact, it creates this perfect circumstance where it kills all the other lactobacillus. So now we have a neighborhood that is dominated by lactobacillus. This lactobacillus iners, it grows like mad and consumes the entire system. I mean, it becomes the most populated lactobacillus. It's consuming so much food that the other lactobacillus can't even grow because lactobacillus is control of everything. Lactobacillus iners. However, they're now working on ways to turn it off. So anyway, what her research found is that with subtyping, many patients who have pain on bladder fill have an overabundance of this bad lactobacillus. So I think what we're going to need to do is just make sure that, number one, we don't take antibiotics unless we absolutely need to. You should not be taking antibiotics when you have flares, because all that does is kill the good bacteria and sets up this foundation for this recurring bad issue going on. And making sure that we're doing plenty of live cultures, that we're eating plenty of foods that will introduce good bacteria that will take control away from the iners. That's why in my smoothie this morning, I put a coconut milk yogurt in there. And perhaps taking a little bit more lactobacillus. We're working on, we'll have a new probiotic coming in that's kind of based upon some of this research that I'll be talking about in the next couple of months. So the best way to get rid of lactobacillus iners is to help the other lactobacillus grow, so it will kill the lactobacillus iners. This is very early research, but it's very, very important research, and we're going to see a lot about this in the future. Okay. So I would just add a good lactobacillus to your daily regimen, okay? And not just one species. Get a lot of species in there. Make sure you look at the label and make sure iners is not in there, although I don't think iners is really ever in a supplement. It's an opportunistic lactobacillus. It's just waiting for the other lactobacillus to have a problem, and then it swoops in and takes control. Renee says she's going to try it. Yeah, good. It'll be a good, interesting experiment. And so that just shows, that every day we're learning things. Every day we're getting a little bit more context. And I think even more importantly, that helps us understand that we're not all the same. The other thing her study found is for patients who have, you guys remember Curtis Nichol proposed 9 subtypes, phenotypes for IC, and I went over that a couple months ago. And on Curtis Nichol's thing, he had one of his subtypes was urethral pain, and he wrote in there that the urethral pain patients are absolutely the hardest patients to treat. That was what he felt in his clinic. And what she found based upon her subtyping is that the patients with urethral pain who did not have pain on bladder fill and patients with vaginal pain, that these patients were dominant in E. coli. They had a pathogenic E. coli infection. So more on that. That's very, very exciting. Let me take a look at something really quick. Donna says, oh, let's see. Okay, we got Donna here. Hold on a sec. So at the ESSIC meeting, the ESSIC is the International Society for the Study of IC-BPS, and they're having their annual meeting in 4 days in New York City. Let's see if, yes, we have the research that's going to be presented. Let's look at this real quick. So I'm very glad to see that they published their abstracts in advance. So here we have a study on the long-term use of Botox. They're calling it safe as a long-term treatment. When the first injection fails, a re-injection should be tried. Now, of course, we would apply this to subtyping a little bit more now. Intravesical tacrolimus, and I see a 10-year experience. That's by the wonderful Dr. Nagendra Mishra in India. He was at Harvard for a while. What does he have to say? He found it somewhat effective for the treatment of Hunner's lesions, it looks like. I'll have to read a lot more about that. Let's see, University of Indianapolis, the Learning to Thrive program of behavioral intervention for people with IC-BPS. Let's see here. This specifically on the chronic overlapping pains. Treatment of chronic overlapping pain conditions remains disappointing, but interventions based on psychosocial models have shown promise. Hello, we know that. Mind-body medicine. We talk about that all the time. Very, very important. So they studied 16 women. Actually, they haven't finished the study. So it's a pilot study. Okay. So we don't have the results from that. Here's a double-blind, placebo-controlled trial on the efficacy of aloe vera in the treatment of IC. Let's see what that has to say. A 4 months follow-up, the number of nighttime voids were significantly lower. Urgency did not show a significant change before or after beginning aloe. So that's very interesting. So urgency and urge incontinence was not helped by aloe. And quality of life improved significantly. Okay. They consider aloe vera to be a safe and effective treatment with patients with IC-BPS, and it could be considered a valid option for conservative treatment of such group of patients. So in the IC Network shop, we have aloe path. That would be the aloe that we would suggest. Microgen DX next generation urine testing may provide added benefit for the diagnosis and treatment of IC. Yeah, baby. Thank you. For God's sake, people, we need good data. Heat over here on YouTube says you've wondered about taking aloe. So aloe has a soothing effect. If you were to have a sunburn, you could put aloe on your sunburn and it would feel good. So aloe does feel good. for some patients in an irritated bladder. But you have to remember that the bladder is not made of plant material. Aloe is a plant material. It's more soothing. So the aloe that we have is, where is it? It's this one, Aloe Path. And the reason why I really like this one is because it combines the soothing effect of aloe with the nerve calming effect of PEA. So quite a few patients are starting to use this for flares, and they're liking it. The challenge with aloe is some people are a little intolerant. They're GI intolerant to it. So if you try it and it gives you an upset stomach or diarrhea, then it's not for you. Okay, but anyway, Allopath is in the IC Network shop if you're interested. So let's see what Robert Evans says about next generation sequencing. Patients with IC often experience symptom flares resembling a UTI. However, their urine cultures are often negative. Next generation sequencing with microgen has the potential to provide a more rapid, less than 1 day, comprehensive identification of pathogens that evade detection by standard culture, thereby providing rationale for antibiotic treatment. The aim of this study was to examine outcomes in IC in patients presenting with symptom flares who received both standard urine cultures and microgen. They did 28 patients who were presenting with a flare. They all had a typical urine culture and a next generation test. Urine culture was positive in only 3 out of 28 patients, while the microgen test found 18 out of 28 patients were positive for an infectious genitourinary pathogen. Total of 23 out of 28, 82%, opted to pursue treatment with antibiotics. In the 3 patients with positive urine culture, 1 out of 3 had a resolution of symptoms following antibiotic treatment. An additional 8 patients who were culture negative, next generation positive, and who opted to receive antibiotic symptoms also had a resolution of their symptoms. Microgen testing identified 6 times more positive urine samples. This likely resulted in more patients opting for antibiotic therapy and experiencing a reduction of their symptoms than would have occurred without it. They conclude identifying a UTI as a cause for a symptom flare in IC patients can be challenging. The microgen test may be a more rapid and sensitive tool for diagnosing a UTI that is potentially treatable, but not capturable by a standard urine test. That's fantastic. Love it, love it, love it. If anybody wants to learn more about next generation DNA urine tests, go to our website, bladderhealth.org, which is dedicated to it. Next generation testing is used for anybody who has complex infections. It's the standard for COVID, as a matter of fact. Okay, here's a follow-up of patients with Hunner's ulcers. What is this about? Oh, they're trying to create a questionnaire for patients with IC. Okay, we can move that out. Ooh, now this is interesting. So when you think about infections, generally, here, hold on a sec. I just want to look something up real quick because I want to get it right. I want to make sure I say this right. Excellent. Okay, I was right. Okay. So if we go back in time, go back 200 years, as they're trying to figure out what causes disease, right? And then they invent the microscope, and then they find bacteria. And of course, they villainize bacteria. All bacteria is bad bacteria, right? Because they just didn't know this 200 years ago. And then they created antibiotics. Now, the goal of the antibiotic is to kill the bad bacteria. And of course, we certainly know that when you kill the bad bacteria, you're also killing good bacteria. And if you read the Nobel Prize winner, the guy who invented the first antibiotic, in his Nobel Prize winning speech, he predicted massive problems if they made antibiotics over the counter. The drug resistancies would go up. We get all these new super infections, et cetera, et cetera. He predicted that back in the 40s, and by golly, it happened. Because in some countries, like in India, most antibiotics are over the counter. You can just walk in and get it. Ariella, always. So anyway, so our approach to infection was to hit it with a chemical, but we know the chemical is damaging. But when we look, now that we understand so much more about the biome, now what we can do is go, okay, this bacteria is dominant because there's not enough of the good bacteria. And so what you're going to see, because ultimately in the end, it's bacterial warfare in our body. It's always the good bacteria fighting the bad bacteria. We don't want to kill everything. We want to try to get the good bacteria good and healthy so it can control the bad bacteria. So mark my words, what we're going to see in the next 20 years or so is we're going to start seeing bladder infections treated with good bacteria rather than an antibiotic, the good bacteria. But another way of introducing, let's see here. Another way of introducing something that will kill bad bacteria is through something called a bacteriophage. Now, a bacteriophage is actually a virus that they can manipulate the DNA with to send back into the body to kill something. And so these are researchers from Russia, big research team from the Department of Urology at Moscow Medical and Dental University. They tried phage therapy as an alternative to antibiotics in just 4 patients with IC who also have UTIs. They evaluated the efficacy and safety of the bacteriophage cocktail. They did 26 urophages in complex therapy. Patients were treated in a bladder installation. They put it directly in the bladder installation 2 times a week for 12 weeks. Before the study, the number of urinations were 40 a day. Let's see. After 3 months of therapy, it had gone down to 15. Bacterial examination of their urine revealed E. coli and Klebsiella, which was resistant to cephalosporins and fluoroquinolones. After 3 months of therapy with intravesical bacteriophages, the number of urinations per day was 15. Nocturia increased. The growth of E. coli and Klebsiella went lower than before treatment, but the sensitivity for fluoroquinolones was restored. Wow, fascinating. No adverse events, no recurrence. That's probably the first really cool study I've seen from Russia in 20 years. Okay, here's something on ketamine cystitis. Ketamine is a drug that's used illegally, recreationally, as an alternative to heroin because it's very cheap. Unfortunately, ketamine is basically an industrial solvent and damages the body entirely, especially the bladder. Patients who take ketamine end up with severe wounds in their bladder. It's very similar to Hunner's lesion. And let's see what these guys, they call ketamine cystitis a new inflammatory bladder disease, which progresses to end-stage bladder conditions, severe bladder pain, contracted bladder, hydronephrosis. Yeah. Well, we know this. Let's see if there's anything else. Study from the Netherlands. One of the problems in Europe is that there are very few meds that are available in Europe. So they're really going more holistic, which is good because we're all going a little bit more holistic. Let's see what else. Yeah, that's not interesting. Ooh, damn. Love it. Now we've got a new study correlating viral infection with Hunner's lesion. Epstein-Barr. Okay, hold on. This is huge. Okay, this is out of China. So they wanted to identify patients who had an Epstein-Barr viral infection in patients with Hunner's lesions. So they did specific testing. They were to identify so these are patients, they already knew they had Hunner's lesions, and they did some testing, including RNA transcriptome analyses, whatever the hell that is, to identify if they also had Epstein-Barr. And patients were prospectively enrolled in a valacyclovir treatment, 500 milligrams twice a day for 4 weeks. Urine samples were analyzed for Epstein-Barr DNA via PCR testing. The analysis revealed an elevation of Epstein-Barr infection pathway genes in patients with Hunner's lesions. The IHC and flow cytometry assays revealed both EBV latent genes and lytic genes. I don't know what a latent gene is. Among 28 patients with IC, 4 with Hunner's lesions who received valacyclovir, urinary Epstein-Barr was detected in 3 patients at baseline, which is what we would expect at that small percentage of patients with Hunner's lesions. After treatment, the pain score went down significantly. But Epstein-Barr was not detected in all samples after the valacyclovir treatment. Now that's cool, because I can remember when the first viral studies came out, and I called one of my colleagues over in Europe. I said, okay, you test for virus. If you find virus, what do you do? And the answer is nothing. We don't know how to treat it. So now we have a really good study that's focusing on a treatment to kill this viral infection in patients with Hunner's lesions. So that's exciting. Woo, that's really exciting. Let's see, what else should we have? Gene expression. In vitro, the role of hyaluronic acid on the urothelial barrier. Ooh, let's see what that is. Hyaluronic acid is one of the glycosaminoglycans found in the gag layer of the bladder urothelium. The exact role of it's unclear. Of course, hyaluronic acid in the form of cysostat or Ilaril is an actual treatment for IC in Europe and Canada as bladder installations. So these researchers in the Netherlands wanted to learn more about what hyaluronic acid did. And they found that removing hyaluronic acid has no negative effect on the barrier. Okay. Quality of life. Oh, okay. This is interesting. This is from Antwerp, Belgium. They're looking at the related conditions to IC, especially the chronic overlapping pain conditions. Any physical or psychological stimulus disrupting homeostasis results in a stress response. Organ cross-sensitization and peripheral and central upregulation influence symptom severity as a stress response due to visceral and emotional factors. Describing kind of that subtype 3 as a primitive stress response in polyvagal therapy. Parasympathetic stress response may be responsible for increased bladder tone and pain. Okay. So again, nobody's saying this is all in your head, but what we are learning that is that when nerves are injured, it causes problems. And that's kind of what we're talking about. All right. Well, anyway, I can geek over this stuff forever. God, I wish I could be there, but I got to be strong. And we all decided that I was just not strong enough to go. Last thing I need is to be, exposed to another round of COVID. So hold on, let me go back to questions now. Sorry about that, guys. I kind of geeked out there. Let's see. Lauren says, after 8 years, I found a great urogynecologist. She said I had vulvodynia, and it's because my pelvic floor is tight. Exactly. She's going to do trigger shots and made a compounded cream of amitriptyline and baclofen. Excellent. You're on birth control because your periods are so bad. Okay. She wants me to stop taking it so we can see what is going on with my period. That makes sense. Let's see. Curious what my body will do off the birth control. I tried an IUD 3 weeks ago, and although my period actually stopped, my pelvic floor and my tightness is horrible, so I got it taken out after 2 weeks, and my bladder is recovering. Okay. Complex. She also said something about IC feeding off estrogen. No, IC doesn't feed off of estrogen. What the pill is doing, hun, is the pill is restricting estrogen. And your bladder needs estrogen to be healthy. So the problem with birth control and the problem with medications like Lupron is it reduces your birth control. And it reduces your estrogen. And as you reduce your estrogen, your bladder wall thins. That mucosal layer on your bladder thins. Estrogen is really important to bladder health and urethral health because it's part of the urogenital sinus, which means that when you were a little tiny clump of cells in your mom's belly, there was one cell that differentiated to create the vulva, the vagina, the urethra, and the bladder. So all 4 of these are extremely hormone sensitive. And so the bladder needs estrogen to be healthy. And when you limit estrogen, you're changing your bladder health. Lauren says, she also gave me Urabel, but it irritated my bladder and made it hard to empty. I definitely prefer Pyradium over Urabel. Yeah, we all have different things. Is Pyradium safe on a regular basis if there's no infection? No, Pyradium is not meant for long-term use. It's meant for short-term use. So, you really need to look at the drug information sheet. I think if you use Pyradium over a long period of time, it can cause some either kidney or liver damage. Lauren said, Renee said, my compounded cream burned me. I'm going to ask about. So anytime you're trying a cream, like an estrogen cream or a compounded cream, and it burns, the first thing we look at is your skin health. Because if your skin is dry, you don't have that nice thick coating. And because you don't have that nice thick coating, chemicals are going to hurt your skin. So concept number 1 is your skin health. If your skin is good, healthy, and it's still burning you, then that means that there's something in that cream that's an irritant, like an alcohol. And so trying different bases would be important. My estrogen cream is in a propylene glycol-free base, and it works for me. Ariella says, are you seeing patients for consultation? I do coaching every day. And so, yes, you can sign up for wellness coaching. Happy to do it. And you can call our office. And if you just have a couple of questions, it's fine. No charge at all. And most of the time, it's no charge. But if you want to get in the upper priority list so that you get more time with me, then I would ask you to sign up for wellness coaching, which you can do on the IC Network website in our shop. But I'm always happy to take questions, always. Hi, Sue. Ariella says, how can you schedule a time with me? Just call. So we're going to be closed on Tuesday, and Mondays are my day off. So I would start calling on Wednesday. And I'm getting up a lot earlier now, so I'm answering the phone a bit earlier now. So I've got the phone number right there, 800-928-7496. I answer the corporate line or the patient education line. So just call, and if I'm available, I'll talk to you right then. If not, we can try to set up a time. The rule in my office is crying patients get priority. So I always tell everybody that we make an appointment with is that if I'm working with a patient who's in distress, I'm going to have to finish with them before I can talk to you. Okay. Bonnie says, can a tapeworm get in the bladder? I don't think so. I don't think so. But you guys, didn't I show you? Oh my God. Let me see. I've got a picture of it. Let me see. You know, I love crazy pictures. I love crazy pictures. And I think that I had this cool picture. Is that it? Let me see if I can find this picture. It was so neat. It was a picture of inflammatory bowel disease, but there was a worm in there. Okay, you know what? Here, hold on. I think I know exactly where it is. This is my file on Elmeron inflammatory bowel disease. Here, hold on. Let me see if I can find this picture. I love showing pictures. Ooh, is that it? No, that's not it. Nope, that's not it. Oh, here it is. So this actually is an accidental picture. This doesn't relate to what we were reading about, which is Elmeron. This is related. It just happened to be a picture on the same page, and it is strongyloids found in a colonic polyp. So if you've ever had a colonoscopy and you have a polyp, so you want to see a worm in the bowel. Look at that. See the little worm right there? And this is strongylitis, and the writing's really small. It's caused by, it's a worldwide parasitic disease endemic to tropical regions. Typically, the infection remains asymptomatic, but it can become life-threatening in an immunocompromised host. This is a 73-year-old asymptomatic female with well-controlled HIV who was found to have strongyloids colitis on a surveillance colonoscopy. So it's important to have the colonoscopy so you get the polyp taken out so that they can look at it. And they just treated it with ivermectin, and she was healed. Isn't that cool? God, I love pictures like this. There you go. No symptoms, but with a little tiny worm. And that's not related to IC at all. Sue says a family member was put on ketamine for fibromyalgia pain. Have you ever researched, because I know it can damage yeah. I mean, I have a whole website on it, ketamine cystitis. Ketamine was originally used only for end-of-life care. So if you had somebody a month away from dying with severe cancer pain, ketamine was absolutely a treatment of choice. Ketamine is used also as a veterinary anesthetic. If you've ever had a dog or a cat get them spayed, and you bring them home and they walk in circles, well, that's the ketamine. What happens when you're on ketamine is you float. There's no anchor. It's a, what do they call it? It's not physically addictive, but it's psychologically addictive. So again, the challenge with ketamine, though, is while yes, it takes that person to a completely different world, it is devastating to the urinary tract, to the kidneys. It can affect fertility. It can affect the bowels. It can affect the liver. I mean, the research on ketamine, when used in quantity, is pretty heartbreaking. But at the same time, we knew that we had more research that showed that low dose ketamine therapy could be helpful for pain. And in fact, for people who have pudendal neuralgia or vulvar pain or rectal pain or perineal pain, sometimes they make a compounded cream that might have some ketamine in it, some baclofen in it, some amitriptyline in it, just to try to help calm those nerves down there. So it's a dicey area. I mean, you just have to be careful with ketamine. If you use so much of it, it could absolutely cause urinary symptoms. And if you keep doing it at a high quantity, it could destroy your bladder. Let me come over here to YouTube real quick. He's God said, I've taken green tea, apple cider vinegar, lemons, grapefruit chocolate out of my diet, but I'm holding on to my coffee and drinking it with baking soda. Am I a fool? You're not a fool, but you're not understanding. You're not understanding the devastating toll that coffee is going to take. As long as you're drinking 1 cup of coffee a day, your bladder will never be able to heal itself. You are interfering with the healing process completely. Because that little stem cell that's trying to grow and change shape and heal the tissue that's been damaged is exquisitely vulnerable to acid. So that 1 cup of coffee sets you back 2 weeks worth of healing. And we learned this at a National Institutes of Health conference with a study presented by Dr. Anthony Schaefer. And he reinforced and emphasized the fact that an injured bladder that's trying to repair itself is exquisitely vulnerable to acid, and acid interferes with healing. It will prevent healing because it's destroying the stem cell. So that's why we always say it's very important to stop the coffee for 3 months, 6 months, and just let your tissue heal first. And then when it's time to go back to coffee, you should be doing the proper low acid decaf coffee or an herbal coffee first. We have a coffee challenge on our website. How do you know when it's time for you to try coffee again? You start with the coffee challenge. So number 1, the first thing you try drinking is chamomile herbal tea or peppermint herbal tea if you can get it down. Some people don't like it, I understand. But chamomile and peppermint are smooth muscle relaxants. They're very calming and soothing to the bladder. If you do okay with that, the next thing you can do is, here, hold on a sec. I just was up at my warehouse. Rooibos tea. So rooibos is a brown green tea, very bladder friendly. So your next step would be to try a rooibos tea. See how you do with rooibos. Okay. If you do okay with rooibos, then your next step is to try an herbal coffee. And that herbal coffee is going to be Caffrey Roma, Caffix, Para, or my personal favorite, Dandy Blend. Dandy Blend is fabulous, absolutely fabulous. If you do okay, and like seriously, I make frappuccinos with it and drink it all summer. I've already had several in the last couple of days. I can make it real weak, not super sweet, never irritating to the bladder. So Dandy Blend is gold. It's good stuff. Then if you do okay with the Dandy Blend, then your next step is going to be to try a real authentic low acid coffee. And Somebody's calling the home phone. You know, I got nobody here. Guys, hold on a second. Nope, they stopped. You know, we're doing all these crazy notices, so I have to answer the phone more. Okay, so real coffees, I think one of the best low acid coffees on the market is made by the Bella Rosa Coffee Company. And the reason why is because it has the lowest levels of the acid that's known for triggering bladder and stomach irritation. The name of the acids is escaping me right now. It'll come to me. Bella Rosa coffee is extremely popular. And the other thing that makes them really good is they have a decaf, they have a half calf, and they have a full calf. It's very low acid, but for those of you who have been on caffeine, but you're trying to get off of the caffeine, you can try their half calf. But the goal is, you got to remember, caffeine is like taking a jackhammer to your nervous system. Ideally, we want you off caffeine because we've got to try to calm the nerves down. But getting you off the caffeine is hard. So their half calf is a really good workaround. So it is the Bella Rosa Coffee Company. And you can get these in the IC Network shop. Of course, we have Tyler's Coffee. Tyler's Coffee is also quite popular, low acid coffee. And then one's been around for ages and ages, it's Simpatico, low acid coffee. So we've got some good low acid coffees that you could try if you wanted. Listen, I love coffee. I love the taste of coffee. I love the smell of coffee, but coffee does not love me. And for me, it messes my heart up very badly. So the last time I was at that's the thing, is I inherited my dad's heart. He had arrhythmias. I get arrhythmias. I get PVCs. I have inherited his heart. We already know that. My sister got my mom's heart. I wanted my mom's heart. I got my dad's heart. Okay. But he lived till he was 100. So there you go. Any amount of caffeine, even the tiniest amount, will cause me to throw PVCs that are awful and icky, and I don't like them. So the last time that happened was a year ago when I drove myself to the ER one Monday morning because I thought I was having a heart attack. And they went, nope, your heart's fine, hon. Nothing wrong with your heart. It's the caffeine. And the ER doctor looked at me and just said flat out, you may never, ever, ever drink any coffee or regular tea again. My heart's just too sensitive to the caffeine. And I don't ever want to go through that. I spent hours at home with my heart bouncing off of my chest before I drove myself to the hospital, you know. Renee says, me too, dad's heart. I know, right? Genetics matter. My dad always said, you know, my dad was cool because my dad always said, because when he was in his 20s, he was in the hospital for a month with his heart being all weird. He said, if you're scared, just walk faster, push through it. And that's what I do. But I don't get scared very often with it anymore. Anne says, someone mentioned after 8 years they found a good gyno. Where? Oh, and Lauren said Cherry Hill. Okay, you guys are good on Facebook. You loved his singing, yeah. Let's go back here to YouTube real quick. He's God said, okay, thank you, Jill, for making the coffee issue very clear for me. Boohoo, all right, got to do what I got to do. Thanks for showing the low acid coffees I can look forward to. Good. Yeah, you just got to do it, hon. You got to give those tissues a break. And it's interesting because I had 2 diehard coffee drinkers in the last couple of days. And one of them was a gentleman, like literally all he drank was coffee, and he was taking massive amounts of vitamin C and suddenly developed all these bladder symptoms. And so no history of any issues before, and then bam, peeing every 5 minutes. And he said his diet was absolutely terrible. He didn't drink anything but coffee, like, I don't even know how many cups a day. I think he said he usually had 4 to 5 cups before breakfast. And so, in that circumstance, we're really looking at a chemical injury to the bladder wall. But the question then is, why is the bladder wall vulnerable? The bladder wall was vulnerable, I think, because I do think he also had a long-term pelvic floor issue. Why? Because his first symptom was actually constipation. And constipation is definitely a symptom of tight pelvic floor muscles. So that, yeah, the diet was terrible on his bladder, but I think underlying that, we're still looking at a muscle issue making his bladder wall so vulnerable. Crazy, right? What was I going to say? There was one other patient. It'll come to me. Excellent. You guys are so good at supporting each other. Thank you. Thank you for stepping in and helping each other when you have questions. It's wonderful. Absolutely wonderful. All right. You got any questions for me? Sue says, what are the best IC safe foods if you're dealing with chronic constipation? Since I've had COVID, extra fiber seems to make it worse. You know, as a matter of fact, I pulled up that I was going to read our section on the IC diet from my book, IC 101, in this meeting. So do we know why you're constipated? Are you constipated because the nerves aren't quite working? Are you constipated? I guess to be disgusting, but you know, we're all people and we can ask these questions. Are you dealing with hard stools or soft stools? Because if it feels like you're passing marbles, well, that usually means not enough water, not enough fiber. So my go-to, I already decided, although I didn't need it. What I was going to eat for dinner tonight was barbecue chicken and green peas. My go-to, if I'm ever feeling stopped up, is green peas. One serving of peas is 13 to 16 grams of fiber. You need to eat 20 to 25 grams of fiber a day to have normal bowel movements. So green peas, beans. I bought some low salt pinto beans. They were quite good. They worked quite well. I used to eat a lot of baked beans with my mom, but baked beans have a bit more salt in it. I'm really working on keeping my salt, my sugar down. You're also getting tested for POTS soon because you have vertigo. Nothing seems to work right anymore. I've heard a lot about the vertigo with long COVID. I've heard a lot about long COVID causing vertigo. So you're not alone, my friend. You're definitely not alone there. I haven't really read a lot of the recent research on what they're finding in long COVID, to be quite honest, but I thought that I read something in the last couple of months that seemed to show that there was, that it wasn't, that it didn't appear to be constant and chronic, that there was, after a year, 2 years, 3 years, symptoms waned and things improved. But I don't remember what that was. That's just me remembering something that I was reading about it. Hi, Mary. He's God said, you were a godsend. For many years, I drank lots of green tea with ACV. Then more recently, I ate a lot of citrus and chocolate. I think you damaged your bladder. Yeah. If you're menopausal, and you have a vulnerable bladder wall because estrogen atrophy, you exceeded the ability of your bladder to defend itself. It's way too much acid. But we've all done it. Not your fault. We've all done it. You just didn't know. She said, thank you so much for all your help. My mind is blown. I feel hopeful. I have to leave the chat. All right. See you later, hon. Have a good one. You know what I think I'll do? So I've got a little section on diet I'd like to read, and then maybe what I'll do is open up a Zoom. Does anybody want to go into a Zoom meeting and talk and ask questions directly? If not, that's fine. If you don't want to do it, that's fine. But I can have a Zoom meeting for anybody who wants to hang out a little bit. Okay, so I want to read a little bit from our book, and Peggy wants to go into Zoom also. Okay, so give me about 10 minutes. Let me just get through this section here. So this is out of our book, IC 101. When Robert Muldrin, Barbara Shorter, and colleagues at Long Island University published the results of the first formal research study exploring the role of diet and interstitial cystitis, their results validated what thousands of patients had known for decades, that certain foods can and do trigger bladder frequency, urgency, pressure, and pain. 90% of the patients who participated in that study reported food sensitivities, a number which has been replicated in several additional studies. And men with chronic prostatitis share similar food sensitivity. Renee, hold that thought. I'll just put a link in there, and you'll just click the link and you'll go right in. To understand why diet matters, you must consider the structure of the bladder. Its purpose is to store urine until it can be released. And because urine can contain toxic chemicals, the bladder protects itself by producing a thick protective coating of mucus on the inside surface of the bladder. But if the bladder is injured or if the mucosal layer is thin due to menopause, urine can penetrate deeply into the more fragile bladder wall. It hurts. Foods that are high in acids, alcohols, caffeine, and histamine add yet more irritation. Diet modification helps to protect the tender bladder tissue while it is healing. Now, patients with Hunner's lesions and bladder wall-driven symptoms are usually the most diet sensitive. However, patients with pelvic floor dysfunction may also struggle with food-induced flares because chronic muscle tension can lead to bladder wall irritation and nerve sensitivity in the bladder. And of course, patients with central sensitization usually struggle with their own unique food sensitivities. The most irritating foods are coffee, tea, energy drinks, soda, fruit juices, citrus, tomato, chocolate, artificial sugars, and foods rich in histamine. Now, the food list. Everybody wants food lists. Over the last 30 years, there have been a variety of food lists released by support group leaders, doctors, companies, and patient organizations. Unfortunately, they didn't often match. They were confusing. Beverly Lauman, author of A Taste of the Good Life, a cookbook for the IC diet, was the first to collect, study, and combine these lists, resulting in the dietary recommendations provided in her groundbreaking book 30 years ago. And since then, research studies have helped to refine those lists. In 2020, we have two key lists. Most patients start with the smaller list produced by the IC and diet research team at Long Island University. It shows patients the foods which are the most known to irritate the bladder, as well as the foods that are well tolerated. So according to Long Island University, our absolute best diet studies show that the most bothersome foods are coffee, regular and decaf, tea, that includes green, black, and white, caffeinated, carbonated beverages, colas, non-colas, diet, and caffeine-free, alcohol, citrus fruit, fruit juices like cranberry, grapefruit, orange, and pineapple, tomatoes and tomato products, some flavor enhancers that are hot and spicy, chili, horseradish, vinegar, MSG, artificial sweeteners. And they made a broad statement of saying ethnic foods like Mexican, Thai, and Indian food. And the rest of us really disagreed with that because there are many Mexican foods that are very mild and bladder friendly. Now, in their study, what were the least bothersome foods? What were the foods that were known for not irritating the bladder? Water, milk, and in terms of fruits, bananas, blueberries, honeydew, pears, raisin, and watermelon. For vegetables, broccoli, Brussels sprouts, cabbage, carrots, cauliflower, celery, cucumbers, mushrooms, peas, radishes, squash, zucchini, white potatoes, sweet potatoes, and yams. Now, I got to tell you, for me personally, Sue, hold on tight, I'll get there. For me personally, I do not eat cabbage or Brussels sprouts or cauliflower because they are exquisitely gas producing. I personally do not do well with gas producing foods. I get gas pain and I don't like it. So I'm not avoiding it for my bladder. I'm avoiding it for my more sensitive bowel. You can eat chicken, eggs, and turkey, beef, meat, pork, beef, pork, lamb, rather, shrimp, tuna, fish, salmon, oats and rice, pretzels, and popcorn. And again, I don't eat oats. I have a problem with oats myself, but I can eat rice every day. Now, obviously, this list is small and in some cases debatable. As an example, many Mexican foods are bladder friendly because they are so low in acid. However, when they're hot and spicy, they can be irritating, so mild flavors are preferable. Some patients may have their own unique sensitivities. Bananas and avocados do bother a small number of patients. But eventually, patients want variety. And these patients turn to the much larger ICN food list developed by Bev Lauman, myself, Jill Osborne, and Julie Beyer. Originally developed for patients who are afraid to eat, its goal is to show patients the diversity of foods that they may be able to enjoy while still protecting their bladder. Obviously, this list represents the experience of the authors and their various support group leaders. You can download this list on the IC Network website, or you can find it on our IC Diet Project website, or you can find it in here, which is our book, our diet book, the IC Chef Cookbook. And if you haven't seen it, the big list is a 3-column list that says bladder friendly, try it, or caution. So let me see if I can show this to you. All right. Where is it? Here it is. Okay, so this is what the 3-column diet list looks like. Usually bladder friendly, foods we're trying, and foods to avoid. And this is 13 pages long. And again, you can download it for free on the IC Network website under our downloads, free downloads. So for example, deli meats. You want to look for filler, gluten, and color-free meats like boar's head. Foods we're trying: ham, bologna, mortadella, prosciutto without heavy preservatives or flavoring. Foods to avoid: heavily spiced, salted, flavored meat products such as salami and pepperoni. So we've really broken it down much more, and it just gives you a lot more options because too many patients get afraid to eat. There's no reason for you to be afraid to eat. And the easy way of thinking about the diet is it's about avoiding foods high in acid, foods high in salt, or foods that are high in alcohol. It's that easy. Okay. You can do an elimination diet where you cut out almost everything. You leave in maybe rice and a couple of vegetables and maybe chicken, and then you slowly add one food at a time to try to figure it out. I did that with my IBS. It was very, very helpful because what I found is that my IBS back in my 20s was being triggered by oatmeal and chocolate. So if you want to learn more about this, we just have a big section on diet in this book, and then also in what I was reading from is IC 101. It's not just a bladder disease, and this fall I'm going to have to rewrite it with the new guidelines. I just haven't had a chance to do it yet. So this is the first edition. We don't have a second edition yet. All righty then. Let me see if I can start a Zoom. Hold on a sec. Why, look at that. It's that easy. Okay, I've just started a Zoom. Hold on, it is connecting. Let me get my video started there. Participants. All right, so hold on a sec. I have to email this to my other computer to give you guys the link over on YouTube. So give me a quick sec. New. All right, hold on one sec. Come on, computer. This computer gets really slow. I have to buy a new one, a new streaming computer. It's going to cost a lot of money, dang it. Zoom invite. Okay, hold on one sec. All right. So I've just emailed that from this computer to this computer. So let me grab it out of this computer now so I can put it in YouTube. Did I put it in Facebook yet? There you go. There's your invite. You can participate from a cell phone. You can, however you're watching this meeting, you should be able to go to Zoom by clicking on that video, by that link. All right, hold on a sec. All right, YouTube, there you go. There's your link to the Zoom. So when we do Zoom, you get to talk. It's not confidential because they're going to hear. They're going to hear me talking to you and you talking to me over this. So if you want privacy, don't come into the Zoom meeting and talk. This is where we're all just trying to help each other a little bit more. So let's see if anybody wants to do this. So hold on one sec. Yikes. Ariella, you don't see what on Facebook? I just posted it. Let me try again. So here's the link. See, my computer's slowing down. Oh, hold on. When you come into the Zoom meeting, I have to let you in, and I haven't looked to see if anybody's tried yet. Okay, so there's the link again. And if you don't want to do it or you can't get in, that's okay. No sweat for me. But I will make that opportunity open. And it is a holiday weekend, and that's why we don't have as many people here, and that's okay. I'm fine with that. I've got lots and lots of things that I can work on. I already had a big long walk. I talked with a lot of people, had some really good conversations. All right. Donna's trying to join. Let's see what happens. iPhone. Okay, here we go. Admit. All righty. And Linda's coming in. I can hear you, Donna. Hold on. Go ahead and mute yourself real quick. So I think what I'm going to do here is, let's see
Only
here.
got 2 of us?
There's 4 of us. And here comes Ariella. Okay, so now we've got 5. Okay, so you know what I'm going to do, guys? I'm going to, since we're in here, I'm going to shut down YouTube because we've only got a couple of people on YouTube. So if you were on YouTube, and here we have somebody else coming in. So we have 6 people now on Zoom. So I'm going to end the stream on YouTube. Well, I can leave it open because it's not sharing bandwidth. So I need you to make sure that you're muted and until I call on you, because if we all talk at once, it's not gonna work well. So
I'm on Facebook. I want to stay on Facebook.
okay. So Linda, I can hear you. I'm gonna actually mute you on my end. I don't remember who came in first. I think it was iPhone. I think iPhone came in first, and then Donna came in second. So hold tight.
Jill,
Yes.
you hear Peggy?
Here, hold on one sec. Wait. Okay, we're going to go to iPhone 2. Is that you, Peggy?
Yes, but you don't see me. I see you.
Okay, so I can, you should be able to activate your video if you want. Okay. I'm going to, oh, here comes Renee.
Start video. There we go.
There we go. There you go. Hey there.
Hello.
How you doing?
Had a bad day today, but I'm doing okay now.
Well, what's going on? What was happening?
Well, I like to exercise.
Okay.
And I used to do 10,000 steps a day, but I haven't done that in 6 months.
Okay.
And I have that machine over there. Can you see it?
Yeah.
And it's very easy on the back and that. So I went on and did 1,000 steps on it, considered 1,000 steps, but it's just like a bicycle, only I sit on a regular seat.
Okay.
And I did about 1,000 steps, and I more or less did it for my emotions to get me feeling better, get the endorphins going.
Right.
And about a half hour later, I just flared up something terrible.
Well, so a half hour is a long time.
No, I didn't do it for a half hour. Oh. It was like 15 minutes at the most.
Okay. And
but a half hour after that, it started.
What kind of flare are you having? Is it a pelvic floor flare or a bladder wall flare?
I think it's both.
Okay.
Can that be possible?
Sure. But the fact that exercise triggered this flare points directly to your pelvic floor.
Right. I think so.
Yeah. So the best thing you could do is get a heating pad, put your feet up, try to relax your pelvic floor.
I got them on.
Oh, perfect.
I've got everything on.
There you go. Grab a good book, and if you happen to have a muscle relaxant, if the doctor gave you some Flexeril or
took what are they called? Those. Oh my God! Hello. Hello. I can't remember the name of it. Oh my God! It's
Baclofen.
I took just a half of Flexeril because I wanted to be here for you, when you got on, and I didn't want to be sleeping. Yeah. So I only took a half of one, and it did help.
If I took a half, I'd be a little on the drowsy side.
Yeah, well, I'm.
You're getting there.
Like I said, I think if I laid here long enough, I'll probably fall asleep. But if I'm talking and watching and listening, I won't.
Good. So. Excellent. Well, that sounds good. It's nice to meet you face to face.
Same here.
And I truly wish you well. Are there any?
Yeah, you were a godsend yesterday. A godsend. I'm telling you.
Happy to help. Happy to help. All right, let's go to Donna. Hey, honey, how is my sister doing?
Hey, girl. Hi, Donna. Hi, baby. How are you? I don't know. I'm hanging in there. Hanging in. Good girl. Good girl. I know the feeling.
So now Donna, you know that you don't have to say anything you don't want to say. So if you don't want to answer this question, that's fine. I didn't realize that you were in the hospital.
Yeah, let me turn it up just a little bit for myself. Am I here? Can you
Yeah.
hear me, Jill?
Yeah.
Okay. Yeah. When I talked to you the last time we had a Zoom meeting or right before then, anyway, I had mentioned that I was in the hospital. I was in excruciating pain that Mark had to call,
An ambulance.
yes,
Oh boy.
911. I've never had to do that before in my entire life. It was just that bad.
Mm-hmm.
Well, let's go back just for a second. You know that Jason died. For the people who are watching right now, my son passed away. He was in the military in
I'm so
19 years
sorry.
in Germany. Oh, thank you, sweetie. Thank you so much. And so I had been talking to Jill and about whether I should go, not go. I wasn't in the best health, didn't feel as great as I would like to feel. And so I went anyway.
You got there, girl.
I did.
Proud
I
of
did.
you.
I
Proud
did.
of you.
I did. It's a little tough to talk about, not because I don't want to share. It's just me now having to rethink.
Yeah.
It was hell. It
Oh.
was total hell in there.
Yeah.
I was doing pretty good right before the flight, and then before I had to leave for the airport. I live in Virginia, so the airport that I deal with is Dulles, and that's about an hour and a half drive.
Whereabouts in Virginia?
I'm in Stafford, Virginia.
Keep going. I'll be right back. Keep going.
My daughter's in Gainesville.
Oh, okay. I got you. And so, anyway, I got to the airport, and just the ride alone was tough. Just getting there was tough, right? And once I got there, and Dulles is very you have to walk everywhere. I mean,
Confusing.
it is in walking long distances, and I just couldn't do that. So fast forward, I eventually had to get a wheelchair, and my husband had to get a wheelchair for me because I could not walk. Literally, I could not walk. I was in that much pain. And in the meantime, I was having to go to the bathroom, of course. As my bladder fills, I'm in pain. And I also have nerve pain. And so as my bladder fills, I have to go. And it's funny because I went to the bathroom, ladies, and am I dealing with all ladies here, or are there any jumps in here? I don't want to offend anyone. I don't want to offend anyone. And when I was going to the bathroom, it looked like I was spotting. I just thought that it was me spotting vaginally because needing hormones. I'm 60 now, estrogen atrophy. It was just a little spotting here and there. And I honestly, I did not think anything of it. I really, really didn't. I didn't think a thing of it. Went to Germany, in the hotel. Me and my husband both got really, really sick. It was not COVID. It was just, we got sick when we were over there. And almost every day for the 2 weeks that I was in Germany, I was with my son at least 11 hours a day in the hospital. And off and on, I was doing that spotting. And I still, honestly, ladies, I thought that it was just vaginal spotting. I mean, honestly, I didn't see anything in the toilet. There was no blood in the toilet, at least visibly that I could see. Went on about my business. We got back, had to have a wheelchair coming back. And when I got back, I think, if I'm not mistaken, I was able to get out after that. I think I was able to get outside, cut the grass, feeling pretty decent. And then, I don't know, everything went south.
Well, I think that
I could hardly walk.
Sorry, I was just listening. Sorry.
No, you're fine. I could hardly walk. I mean, I could hardly stand. I couldn't even stand. I mean, it was all I could do to get to the bathroom.
Yeah.
And this went on when I got back in February. He passed away March 1st. Technically passed away March 1st. So we're talking March, April, May, and June is when the pain had gotten so bad that we had to call 911.
Yeah.
They take me to the hospital. I'm in excruciating pain. They give me morphine after they figure out what the heck is really going on. And come to find out that I was nearly septic.
You were septic.
Oh,
Yes, I was nearly septic. And I kept, and they asked me, they said, well, did you see any? But here I am. I'm holding myself, and I have a tendency to hold myself down there because I have the nerve pain, the vulvar pain. So I have no shame. When you talk about no shame, if I'm in pain, I'm holding myself because that's the only way that I can get through it, to walk, to even struggle through it. And they were asking me while I was in the ER, they were saying, you hadn't seen any blood. And I was like, well, no. And me saying it was honestly because I didn't think that the little spots that I saw throughout the trip and when I got back, I didn't think of it as a UTI or a bacteria because I never had a UTI day in my life. I didn't even know what a UTI was like. Had no idea. And then I'm thinking it might be I kept saying, I can't wait to get back to see my GYN because we got to get some estrogen going here. I had all these things written down. So to me, I had nothing indicated in my head that it could be a UTI because I never had one.
Yeah.
And they told me that they said, thank God you got in when you did.
wow.
Because had you not gotten here, oh my gosh.
See, UTIs are very common on trips because you don't drink water. So you're not drinking as much. Most people, it's very, very common traveling to get a UTI because you tend to be afraid to drink the water. You don't know if the water's good, especially if you're traveling below the equator, but even above the equator. And then you can't drink a lot because you've got the icy diet, and then so what are you going to do?
I have to excuse myself for a second. I'll be right back.
Okay, baby.
Okay, honey. So it doesn't surprise me that you got a UTI after that trip, hon. It doesn't surprise me.
You know what, Jill? My thing was it after the trip or before the trip? Because I was seeing a little bit of spotting, nothing visibly in the toilet, but still seeing a little bit of spotting, and not even thinking, Jill, that that could be it. So my question to myself was, how long had I had this?
Oh, probably weeks.
You know what I'm saying? And the pain, I'm telling you, Jill, was so bad. I had ice down there earlier because I just couldn't stand it. I didn't even know what to do with myself. It was so bad. So my thing was, oh my God, Donna, how long could you have had this? Could your belly be this? When you were bloated, could you have been? Things just ran through my head.
So did they identify the bacteria?
No, you know what? They said it was they didn't tell me what the bacteria was.
Okay, and did they put you on antibiotics?
They did. They gave me 4 rounds of Rocephin.
Okay.
I think it was 4 rounds of that. One the morning before I left the hospital, as a matter of fact.
Okay.
And I hadn't had an antibiotic since I was diagnosed with IC, which was like 8 years ago. So, you know how you give you the antibiotic just in case you have a UTI and you don't.
Are you better? Are you better now?
I'm worse. I'm not worse. Things are worse now than they were before I went to Germany.
Okay.
Probably because of the inflammation from the UTI is from the lining.
It could be. I started thinking. I said, if I had been like this for 2 months or 3 months, could all of that and the strain of me going on the trip, and I was in Germany for 2 weeks, of going on the trip and being there, could that have literally just wreaked havoc on my nerves, on my vulvar area, my vaginal area? Because now I'm on Oxycontin. And I wasn't on that at all.
Okay.
And now I find that, I'm back and forth with my GYN regularly now. We do chats and everything. And I told her, I said, I can't even get out of the bed to walk, to put my feet down if the pain is that bad. I don't even know what the gabapentin is.
Well, it sounds like, have they done follow-up testing to see
No,
if you still have
now,
infection?
well, I've only been out of the hospital for 4 weeks now. It'll be going on my 4th week now.
Okay, you need a follow up urine test and a next generation DNA urine test to see what's going on.
Well, I had the follow-up urine test when I went to see my GYN when I got out of the hospital. It was
Okay.
a week ago. She did the follow-up urine test.
Okay.
It was negative. I thought about doing the next generation test just to see whether or not there could be something that they didn't see
Right.
or that they didn't catch,
Right.
because I've never done that next generation testing. However, my question to myself and my question out there is, could that infection have done more damage to me,
Well, yeah. I mean,
or the results of, because I was in such pain, out of control pain, going on the trip and being in pain, that constant everything generating, turning on, nothing to really combat it, really. It's just me dealing with all of that pain there, coming while I was there, coming back on the plane, being here, and then the infection. And then, we talk about our nerves and how stress on the nerves. And I'm thinking, oh my goodness, could my body be in that, in a sense of,
it is, honey.
It's nerves and nervousness that it doesn't know how to get out of.
Well, it's not. It's not that it doesn't know how to get out of. It knows what to do. It's just, this is the toll of deep, profound stress. You went through the worst thing any mother can go through. You lost your son, and that affects you. That affects your body. It affects you physically, mentally, and emotionally, but it also affects your immune system. So it's not surprising that, and I'm kind of waiting for this. I mean, I'm trying not to wait this for me. I think my blood pressure is up a bit, but I mean, how can it not be at this point in time? But the cold that I had COVID, and then I had this worst cold I've had in 50 years.
And when I was there, Jill, I was just telling the ladies, when I was there in Germany, me and Mark both were sick as a dog. I was there. I was telling the ladies that I spent at least 11 hours with Jason every day except for 2, because they sent us home because we were so sick.
Yeah.
Back to the hotel.
Well, said, and you might have picked up COVID on the plane. We
tested and didn't have COVID. And the doctor said here, she said, people do get sick when they go, and I hadn't been out of the house. We hadn't been, and just being exposed, and and I thought, my God, we were so sick there, but still plowed on, nothing stopping us. Jason was like, Mom, I had read a quote that said, when a person who is in pain takes care of someone who is in pain, that's love. And I think that is definitely love. And I think that my son was telling me, Mom, look at me, and here you are, me looking at him in pain. There's only so much I can turn away from. He knew about IC, but however, he didn't know that I was like this, because I had to do what I had to do. And, here we were both looking at each other as if this, he was like, Mom, sit down, Mom, I know. And here I am piddling and trying to get things together and helping him. And, he's like, Mom, sit, and I just think to myself, we're all in that same boat, especially Jill. I know, how it is. You've been taking care of your parents for so long while you're in pain, and everybody's in this state of pain. And I think now, as I'm sitting here with you, I am in pain. I took the gabapentin, the 300 milligrams, which I don't think is working now. The Oxycontin, that helps, and that's 5 milligrams. She wants me to do it every twice a day, or I can go to once a day if necessary. They're not denying me at all, which is a blessing, because I don't know what I would do.
Yeah, I think though my concern is that you're chasing the symptoms, and we want to make sure that we know what we're dealing with. And listen, OxyContin is big time stuff.
Yep.
And
Yep.
you got to, you're in a lot of pain. I'm not against it at all. Except obviously you can't cut it in half because it's time release. You got to be really careful with
Exactly.
that.
Exactly.
But given the amount of pain that you're in, I would, number one, want to have a next generation DNA urine test just to make sure they killed the effer.
I hear you. Yeah.
You know, I want
hear
to
you.
make sure that all the pathogens have been identified and treated correctly, because there's a chance that you have a drug resistant infection that is actually resistant to the Rocephin. And given the pain level you're in, I would be on Wednesday after 4th of July is done. I would be, well, you can actually order it tomorrow if you're willing to pay for it. It's $199. Order it, get them to send you the kit.
Yep.
And you'll have to get your doctor to sign it, but I'm sure she will, to get the results. But I think it's just to dot your I's and cross your T's. I think it's very, very important that you do that.
And of course, Jill, the estrogen atrophy was also something that we addressed as well. And I have tried the patch, I have tried the ring, I have tried the cream, I have tried the I have tried it all except for the pill.
Right.
And so we talked about it. I have no cancer, nothing. My mammograms are great. I hadn't turned 60 when I saw her. It was the day before I turned 60 that I saw my GYN, which was the 10th. And I told her, I'm not 60 yet, right? And she's like, okay.
That's the cutoff right there.
Yep, that's the cutoff. And so I said, we tried all these things, and she's very good at experimenting. And I give her all my IC stuff, and I do. I print off the AUA guidelines for her because she reads all this stuff, because she doesn't get to it. And so I said, well, let's go with the oral. And she says, okay. So I'm on the 5 milligram, the 0.05, 0.5. Thank you, sweetheart, of the estradiol. So we're trying that, and I've only been on that for 3 weeks. Yeah. And it takes at least 4 for that to kick in. And I'm just like, I'm in pain now. I mean,
are you doing the Piora?
Yes.
Good.
And I'm doing Cystomin.
Okay.
See, I'm doing, and she knows that. She has no problem with any of it. It's just that before it was working, I was at least able to get up and move around. I could walk outside. Now, forget it. Everything, everything, you talk about central sensitization, it's like it's off the chart. Everything, my senses, everything is like, it's 20, it's almost.
Well, you've been through a traumatic, not only travel is traumatic, but losing a son is the uttermost God-forsaken traumatic thing anybody could go through.
Oh, it's just,
I know, baby.
Hey guys, can I ask you a question for those in Zoom? Would anybody mind if I shared the screen so that other people on Facebook could see you, or would you prefer that I not do that?
I have no problem.
No problem.
Okay,
no problem.
Shake your head this way if you don't want me to do that.
No problem.
Okay, so we're good with it, because I realize you're talking, and
I'm good with it.
I think people on Facebook, YouTube, I'm sorry, I can't share it on YouTube, but let's see here. All right, I can make this much bigger.
I think when we share and we see each other's faces, it's real.
It's real. It's even more real, isn't it? It's even more real.
Yeah.
Yep.
Definitely.
Well, and I think it gives us hope too.
It does, baby. I love seeing your faces. I do. I love it. I think it's absolutely wonderful, because we're all in that same boat in some form or fashion. And when we're talking to Jill, chatting, it's impersonal. When we're like this, it brings, at least for me, it brings me closer to you, and it brings me closer to her. I mean, in that sense, it becomes even more personal. It's like, I'm serious. Yeah.
I mean, it's just so nice to, it's like we found our people, because one of the things that I honestly have struggled with my whole life is that I have felt very isolated and lonely.
Mm-hmm.
You know, because for me, this started in 7th grade, right?
Yeah.
And so when all those people are building their friendships, as college friendships and everything, I was rushing to the bathroom. And that's been like a common theme my entire life, where it's just like I feel, I mean, in addition to being the aunt, you know, don't even get me started on the role of aunts in families,
Yes.
you know,
Yes.
so there's tremendous comfort in being able to look you in the eye. And I'm looking, I don't know if you can see, I'm actually looking you right in the eye, Donna. I know, you know, I mean, the
Right.
camera's
I
up
know.
there,
I
but I'm
know.
looking at you.
Right.
And I think that we have to break the isolation, regain our
Yeah.
power, use our voices, work together, because
Yeah.
we're not less worthy than anybody out there. I think we're more worthy. We work harder, and we have a vital roles to play in our families and in our communities. And yeah, we got hurt. Lots and lots of people get hurt. Lots and lots of people get infections. And and the blessing in all of this, aside from the absolutely wonderful people that we get to meet and the friendships we
Yeah.
make and the connections that we make,
Yeah.
is that, and I promise you this, you will use this to help someone else.
Absolutely.
We
That's true.
I was walking today and I was talking with an elderly lady living alone, and she said she was having bladder problems. I did the whole GSM thing on my walk this morning. You know, there's tremendous comfort in knowing that we can help others so that they don't suffer the way that we suffered, because we suffered.
Yes.
And our job
And
now
we
is
suffered alone. Alone.
alone.
Yes.
And our job really is to make it better for the next generation.
And you know, Jill, and everyone else that's watching, you know, it's interesting because and don't get me wrong, my son died of colon cancer. Just so everyone knows, he died of colon cancer, and it was very, very aggressive. And so while I was watching him and talking to the doctors, and of course they were some of the most at Longshore, they were Army based. They were some of the most wonderful people, healthcare providers for my son.
Oh yeah.
And of course, I walk in and they're seeing me and they're like, they were calling me Donna. They said, Donna, what's wrong? And here I am holding myself and telling them, and they're like, wait a minute, you're not getting, how are you dealing with your pain? We're talking about pain levels. Then we got on to talk about people who, what I want to call it, with the drugs, people who,
people who are addicted.
yes, who are addicted, and versus what our society and how our society has dealt with all of that. And it puts people like us in the IC who don't abuse drugs. Not usually. Data has looked at that, right, Jill? That we don't. However, when we're talking about bladder pain, now I'm not saying that somebody with an arm, I'm not taking anybody's pain away from anyone. It's yours, and I get it. But vulvar pain, vaginal pain, bladder pain, urethra pain. I'm going to tell you guys right now, I don't know, a minute if you want to, there is nothing like walking. I mean, when you pee, and the pain is so excruciating. I don't know how when I don't even, Jill,
I know.
it is kind of the worst pain. And I know my son is sitting there and he's watching me and he's like, Mom, go, he knew it. Mom, go to the bathroom. Mom, and you know, I know because you can hear through the in the toilet, you could hear through the bathroom door, right? And here I am trying not to, you know, I'm sitting there doing my padding and doing all of my little, you know, stuff to divert the pain, and they can hear that.
Yeah.
And it's like that's something that I could not hide. Not that I wanted to, it was just I was trying to deal the best way I can.
But I think people need to see that. I think we tend to hide our pain because we don't want to be put in that category of of medication seeking patients.
That's true.
And it's very disheartening, discouraging. Yes.
And especially mothers.
Yes.
Mothers are very good at hiding it from their family.
Mm-hmm.
And I really disagree with that, because we have to teach our family compassion. That's when somebody in the family is in pain. We have to be there for them. So, Donna, let me go to somebody else now.
Go.
Okay, but you hang tight, okay?
Okay, I will, sweetheart.
Okay, so we've got Renee and we've got an iPhone. I think iPhone, I'm sorry, I don't have your name. Renee, if you can hold tight, I'm going to go to iPhone first, okay?
Okay, that's fine. I'm on the phone.
Okay, honey. Now, first of all, I see you're sitting out in the beautiful sun in a rocker and I see water behind you. Yeah, that's you. But you need to turn your sound on. Or you need to say something and let's see if we can hear you.
Are you talking to me?
Are you wearing a white hat with a white shirt? And
No,
you're sitting.
Not Renee.
Yeah,
it's not Renee.
Not Renee. It's the other one.
Okay.
Tell her to tap her screen if she has her iPhone, and on the bottom it will see a video with an X in it. She needs to push that to get that X off of there, and then it will come in.
Well, she's not muted.
Hmm.
She's not muted. You might. You know what it is, honey? It's probably your buds. If you can take out your buds and turn your speakerphone on your phone. Try that. Okay, now just try to say something. Nope, still can't hear you. Looks like she's going to go to get some help. Oh, the joys of technology. Not. Okay, now she's mute. Okay, hold on. I'm going to ask her to unmute. Okay, so that changed your setting. Hold on. Now it won't let me click that. Can you unmute yourself? If you put your finger on the phone, and you should see a little microphone with a slash through it. Click it, and it should unmute it. Nope.
Right on the bottom. I'm doing it right now. There's a microphone, a video, participants, chat, reactions. If there's an X through any of them, you just press it.
Let me see if I can join with my iPhone. Hold on a sec. So I can look at the thing. Here, hold on a sec. New message from Kaiser? What? Why would I have a new message from Kaiser? Oh, that's an old message. Okay, here, hold on. I got the Zoom invite. Your token has expired. Please sign in again. All right, hold on. Okay. Okay, so I'm just entering under the name Jill from my phone. To hear others, please join audio. I'm going to do it with Wi-Fi. So it's giving me the option of doing it with Wi-Fi. See that? Now we got the oh, that's me. Here, don't say anything, anybody. Hold on. Okay. Ah, come on. Okay, look right here. You see? Oh, come on. You see the phone and the video? Make sure there isn't a red line going through the phone. Now I just muted it to stop the reverb. Okay, we just lost her. Maybe she's going to try again. Okay, let's go. Let's go to Renee.
Hey,
hi, Renee.
Hey. I was just going to encourage Donna about this grief, honey.
and Jill as well. The grief will absolutely put you into some kind of spin. Jill is certainly a strong person, but my situation was almost exactly like yours, Donna. And I had two people pass away shortly after all that hit me.
Yes.
And it took a long time. I'm telling you, it took about 6 or 8 months to just get things calmed down, get the medicines backed down a little bit. And Jill's network has helped me a lot. I got her book and ordered things from her. But yeah, that nervous system, I've got the type nervous system Jill does with whatever it is, widespread pain. You can't touch anything, do
I
anything.
call it high octane. You got that right, lady. That is right.
It's a rough thing. But you have to dial it down. And Jill's an expert at that, dialing it down. Every way you can. Jill can throw that in there. You have to dial it
I
down.
did the stop sign all day yesterday, Jill, and
Yeah.
today.
I mean, as I was sitting here, my veins started to pop, like my blood pressure was going up. And so I went and I took a quarter of my low pressure just to chill it out. And I am finding I'm not angry. I'm just baffled and frustrated with my body. I have barely been able to write in 6 weeks. I mean, the first month I got nothing done here other than talking to people on the phone. And now I'm starting to write again, but my focus is very easy. I mean, I can get 30 minutes in, then I got to walk away, and then I can get 30 minutes in and walk away. And I feel I was researching. I was really having trouble with my memory.
This is normal. This is normal.
Yeah.
I mean, like searching. I was
Especially
searching for words like I've
Yes.
never searched for words before. And
Yes.
it kind of freaked me out because it was like 20 times worse than before they passed. And I was reading about the stress on the brain, and that losing words is completely normal with high levels of grief, that's the effect of that grief on the central nervous system. And it's so the words are slowly coming back, but man, it's
Well, you
just
can't be too hard on yourself.
no,
Or Donna or anybody.
no.
Don't
right.
absolutely need to do this, but don't.
Yeah,
If you can help it, just don't.
no, yeah.
It's kind of a habit with women. We're going to do this. We're going to do that. We're going to press on, no matter what, and we do. But this grief is a different deal.
It is.
It's just, and it's very sobering. I mean, like I feel joy for my mother in spirit. Honestly, when she passed, I saw her fly out of her body. I mean, just in my brain, it's just like with such relief to be away and out of this body that had confined her for so long. I feel this intense joy and happiness from her. I do. And from my dad, I'm just feeling like he's not happy, but it was inevitable, and he's like, I was ready to go. I was ready to go. I knew it was hard for you. But I don't think, and people kept saying, are you ready? And I'm like, yeah, I'm ready. Oh, holy hell, Mother of God, you're not ready.
Oh, you're ready.
You there's just no way to prepare yourself for this. It's just
way. What I have found is it's been since 2021 since I had this double grief thing. For terrific. Donna, your story is about exactly like mine. Hospital, but go to the hospital more times than one.
Yes.
And, you know, then I found a pelvic therapist and things like that and just did the multifaceted work that Jill tells us we have to do.
Yeah.
Was right. And, but lately I've just been dreaming about my dad. It's been very weird. It's been 2 years. I haven't had any dreams about him. In the past week, here's been. And we didn't get along all that great, but you know, I'm like, I mean, we got along, but you know, it's been bizarre. It's kind of like I've been trying to shut him out a little bit, but he's coming. And then my grandmother came last night, and it was just like she was right there. And I said, "Thank you for coming." In the dream.
Yeah.
And I do think they do come, but you know, like I have tremendous faith and I have tremendous spirit. I watched the and I've seen oh, see, I'm having a brain moment. You know, that psychic guy.
Yeah, I hear you.
Brain fart. Yep.
A brain fart. Yeah.
Brain fart.
You know, one of the first things I did, like the week after, was I watched the Tyler Henry show on I think Apple Plus or Amazon Prime, and he's that young Hollywood psychic, but it's so much more. And I get such incredible comfort because, like, okay, what's the name of that guy? Oh my God, he had his own TV show. He's appearing here in January. Oh, I can see his face. I just can't remember his brain. It'll come to me. Anyway, I've seen him. John, thank you, Danielle, on YouTube. John Edward, and yes, I lost both of my parents. So I have been going and seeing John Edward many times. My best friend took me. I was a total skeptic. Come on, I grew up in a conservative home as a chemist. There wasn't a lot of left brain stuff in my growing up, and I was converted. The joy. So if you ever go to see John Edward, what's cool is, he always starts with this 20 or 30 minute kind of riff. And he said, I'm not here to entertain you. I'm not here to answer your questions. I'm not going to prove I'm doing this or that. I can't give everybody in this room a reading. This is what I'm going to tell you. The people who need a message are going to get a message today.
Mm-hmm.
And then he slowly, he'll get a vibe from one area. And he'll narrow it down. It's like, okay, I've got this coming through. I've got a young man coming through. He's showing me a truck. And in the end, that was a young man who was fleeing the police, who died of an accident. And you just can't make any of this up. I mean, he's down to detail, and the pets that come through, and the messages. One of them, for example, was from a young woman who was sitting in front of me, like 5 rows in front of me, and her grandmother came through. And she was very skeptical. And she said, okay, I've got this real feisty woman coming, and she's right here. And then he was able to kind of identify the woman. She was like, yeah, that sounds like my grandma. And the message was, are you struggling with your career? She was a police officer. Do you want to be a police officer? She's asking me to ask you, do you want this? Or is there something else that you want? And the daughter was just gobsmacked and went, no, I'm trying to decide right now if I'm going to keep this job. I don't like this job. And the grandma who had come through said, you're really good helping people with medical problems. Are you thinking about being a nurse? And she's like, yeah, I'm really thinking about being a nurse. And grandma said, that's what you're supposed to do. I'm here to tell you that you're moving in the right direction. And there have just been lots of different stories like that. I have a funny story, though. I have a really funny story, okay? So I went and saw him like 4 or 5 times. When you walk out of those, feel so good. You feel so comforted. You walk out believing and knowing intrinsically that you are never alone. And that's exactly how I feel. And I've shared my guardian angel story where this was my first year with IC, and I was in agony, and my guardian angels came. And it was my grandma who had been dead for 40 years. And I saw her standing at my feet telling me I would never be alone. And that's why, I have a strong, strong faith. Anyway, so the last time I went and saw him, which was right before COVID, my cat had just died. My cat of 20 years had just died. And I love my cat. And it was too much for me. I walked into the room. This is going to sound nuts. And there were so many people grieving. There were so many people grieving. I lasted about 30 minutes. And then I just had to leave. And I got in my car and I started bawling and I cried all the way home. And I cried for a couple of hours, right? So I'm in the car on the way home, desperately missing my cat, who was my child.
Mm-hmm.
And I have two friends in the audience sitting in completely different parts of the auditorium. So one of them calls me and goes, "Oh my God, Jill, you're not going to believe it. Your cat just came through." And I'm like, "What?" I said, as soon as you walked out of the room, a cat named Sammy came through. He described your cat perfectly. Your cat came through to tell you your cat was okay.
Wow.
Now, I haven't talked, John Edward doesn't know anything about my cat. And then my other friend called me after she was done. "You're not going to believe it. Your cat came through." So anyway, I'm a believer.
Yes.
But if you can, watch the Tyler Henry show. It's just very comforting. And I just find it very comforting. So listen, we've got iPhone in again.
Oh, good.
White hat.
That's me.
Yay, it works.
Hello. It's Mary.
Hi, Mary.
Hi, Mary. Hi, Donna. Hi, Jill.
What can we help you with, Mary? What's going on?
I just wanted to share something. I'm doing pretty good, but you spoke last week, a couple weeks ago, and you've spoken like this before, but for some reason, it just rang a bell with me. You talked about the pelvic floor, cutting off oxygen and blood to your bladder, and then you learn pain and X, Y, and Z and all that stuff. And so, I got out an old TENS machine that I had, and I was using it every day religiously on my bladder, and I'm visualizing that the blood and the oxygen is getting into my bladder better, because I hate to say, I don't want to say I'm superstitious, but I'm feeling much better.
Well,
and then and another thing too, Jill. So like 4 weeks ago, when I was having a pelvic floor therapy and she checked internally, it was like bee stings. I mean, it was nasty. And the last week when I went, there was no difference between the right side and the left side.
Yes.
So
you're making progress. Hold on a sec. Let me get a book real quick. Hold on.
I have a TENS machine as well.
do you?
Yeah, I know. I'm sure Jill
Where do
knows
you place
how they
it?
work.
Where do you place
Okay, there's the little, the little pads that are going up to the cords, and I place it right on my pelvic bone, right over my bladder, and then there's different settings that you can use. I don't even know which one I'm using.
Well, that's what I'm going to give you. I'm going to give you pictures right now where to place it. It's out of this book, Ending Female Pelvic Pain. Hold on a second. I can show you pictures. Let me just find it.
This is very helpful. I'm so glad you're about your TENS.
You put them on your back?
There's so many things. I mean, anxiety, all that stuff just wreaks havoc on your blood flow, and I mean that's my conclusion, that I've with my bladder cut off.
It makes sense.
Body.
Okay, so she's got 5 different ways of doing it. So here's number 1. So that's just kind of going straight up the spinal cord. And Donna, you got nothing to lose. It would be interesting for you to.
I've got the book, and I've also got the TENS unit too. I've got that early on. Yeah.
Okay. And Ariella, what did you say?
I have the book, but you see the page so I can log on.
Yeah. Page 229. 229.
Okay. 59. Okay, great.
Okay.
Thank you so much.
Okay, so here's another picture. So you can do lower back, two more on the glute, two kind of, well, you can see kind of a square.
And
Okay.
that's the one my pelvic floor therapy, she did that initially.
Okay, or you can
Yeah.
actually put the pad more centered on your glute muscle rather than up and down.
Yep.
Okay.
Yep.
Or, okay, you guys, for everybody watching, you're gonna see a bottom. It's okay.
Yes,
So in
okay.
this case, we got two pads here, but we have two at the base. You can see
Oh.
right there.
I hadn't thought about that, but I would try it.
That makes sense.
And
I
then
would.
Well, Jill,
along
Can I
the bikini line.
can I ask you a question, Jill? It's Mary.
Yeah.
So do you see anything there where they put it directly on their bladder? Because that's where I'm putting it. And I'm not using a real high intensity, but I can feel it,
It's right there.
stimulating that area.
See that right there?
Have you
Oh,
noticed,
yeah.
Mary, have you noticed a change in the pressure in your bladder?
Absolutely. Absolutely. And some days, I don't know about you guys, but when I'm not feeling too good and I have to go to the bathroom, it's a discomfort sensation, not like when you normally have to go to the bathroom and you feel pressure. But the last few days, I've had the pressure, or I guess for lack of a better way to express it, my old-fashioned way of peeing. It's not consistent, but it makes me think that things are, maybe happier in there.
Mm-hmm.
Okay, so what she says here for the bladder, so helps reduce pain when sitting, pain with positional changes, bladder pain, and generalized pelvic pain. Place pads in a semicircle near and around the pubic bone. So you can
Yeah.
see
Yep,
that?
that's what I do.
Just like that. So two over the pubic bone and two that way.
Okay.
And I'm a firm believer in internal work by your pelvic therapist.
Oh God, that's the most
I am a
important.
believer.
Oh, I am
And
too.
when we listen to people like Jill and you listen to what she says and you incorporate it in what's happening to you and your pelvic floor therapist, I mean, it's just a marriage, to me. It just makes things a little more clear.
Also,
Mary,
Once you
Mary,
have that realization.
from a scale of 1 to 10, when you first started with your physical therapist, 10 being the worst, 1 being the best, how are you now compared to when you
I
first
would
started?
say when on my worst day, maybe I'm a 4 or 5. In the last week, just in the last week, that's why I hesitate to say, I want to be encouraged. I'm excited about feeling better. I mean, I'm even to the point where I want to have people over to the house and fix them some dinner.
yeah.
But you definitely noticed a difference.
I know
So,
we get so used to being alone.
So I'm doing something and I think, oh God, I'm not even thinking about my bladder. I mean,
good things are happening. People ask me, so this is the body position I do when I use my wand. So I lay in my bed and I put my feet on the wall and then I do my wand that way for anybody who is asking about that.
Jill,
Yeah.
with the pelvic floor therapist, she gets up there into places that I can't reach.
Oh yeah.
And she knows me really well, and she'll go right to that place. And like for weeks, it's been like, whoa, like maybe nobody else can relate to this, but it's totally like a bee sting, a major bee sting. And I can't get that. I reach up in there with the wand and my finger, and I just can't hit high enough or something. I don't know, but apparently it's loosened up.
Well,
So you went from a 10 to a 5? Is that what you're saying?
Well, I've been all over the board for the last 2 years, and not knowing what was happening and listening to everybody. I mean, it's like, I don't know about you guys, but it's like a bunch of fish swimming around in your head. It just, okay, is it bad?
Yeah.
Is it thick? But what? But like I want to reiterate, like 2 weeks ago, Jill just, by the grace of God or whatever, what she said to me, it was like I plugged into it and I thought, that's what's wrong. I'm not getting enough blood and oxygen to my bladder.
The circulation, she's right.
Yeah.
It's all about blood supply and for all of us that are here, it's also, we also have to respect the loss of estrogen. I don't know how old Ariel
Absolutely.
is, so.
Well,
I
it's
it's not just
starting
one
on
thing.
age.
It's a many, many, many things. You know, I think I brought this on by myself. When my mom passed away, believe it or not, 6 years ago, I went into this deep depression, horrible anxiety, and I think I just tightened. You know, I went to fight or flight. I was in it like 24 hours a day, and I've never had a problem with my bladder. And everybody kind of came to that conclusion that you are just a tight walking pelvic mess.
Mm-hmm. That fight or flight.
So
is a
there's
bad
hope for
thing.
us, right?
Yes.
I'm
yes.
asking for myself because I'm 20-year survivor of IC. When I first was diagnosed, I had severe IC, and back then I worked with the urologist, and he kept telling me I had IC, and I said, no. Well, he finally, I remember distinctly one night my brother-in-law brought up some horseradish cheese spread.
Ooh.
And we had it on crackers, and I just like overdosed on it because it was so good. Now, mind you, nothing was happening prior to that. Well, that morning I woke up and I was in bed for a year after that.
Woo,
Wow.
For a year.
That was the trigger.
Yeah, and my doctor was a wonderful doctor. He got me out of it. Of course, I had to go on pain medicine, but he also put me on Elmeron, and within probably 4 months from doing all that, after that year being in bed and me just being a stubborn thing that I'm not gonna go on medicine. I'm a nurse. I'm not gonna do that. I'm gonna beat this myself. And the doctor kept saying to me, Margaret, you can't beat this yourself. You need my help. So I finally got his help, and I got back to somewhat where I could, go in my garden, do stuff with my child, go visiting,
I have to leave right now, ladies. I'm sorry, my daughter's here. Prayers for me.
Okay. Nice
Bye-bye.
meeting you. Nice
Bye-bye.
meeting you.
Bye. See you
Bye-bye.
later.
Bye-bye.
Have a great Fourth.
Thank you.
So, but anyway, after all at 20 years, here about 3 months ago, my girlfriend's, my best friend who lives down the road from me, her nephew committed suicide upstairs in her house. And at that time, I didn't know about it. And I was coming home from my daughters from Virginia, and I had a migraine, and the ride was long. We had traffic, and when I got home, I was in an intense thing of nerve endings. I was like, please, I just need to calm down. And then her daughter called me and told me about that. And the next morning, I was in a flare, and I have not been able to get out of it since.
Stress is big.
That was 3 months ago.
So Ariel is asking about TENS units, and I just went to Amazon, and you can get
They have them.
$36.49 with Amazon's Choice, 20,000. I bought it in the last month. 88,000 reviews.
Yeah, don't buy it from your doctor. They'll charge you $400 or $500 for it. Get it right on Amazon and get it.
Well, I also have to interject something here too, because there's so many different things that can be wrong with your bladder. I don't think I have interstitial cystitis with any kind of lesions or anything like that. I just feel like my pain is a result of years of anxiety and my pelvic floor being screwed up.
Yeah. Yeah, it's honey, it's a layered pelvic pain syndrome. It's like an onion. We got to peel the layers. John is asking on Facebook if she said the settings, and the answer is no. Hold on, let me look here real quick.
I go up to about 10 or 12. You'll know, and there's different modes. I mean, it's like a vibration thing, and then it'll pulsate. And I could never find any description in the manual that, led me to use it for bladder specifically. So I just played around with it.
I'm going to go see if I can find mine. Hold on.
Okay. Yeah, I probably need to pull that out. I've got mine hidden someplace somewhere.
I don't know.
I gave mine to my sister for her back.
Oh, did you? You might want to get that back or get another one.
I think they're cheap enough where I bought it for $39 on Amazon.
Hey, you two, do you guys drink a lot of water?
I do.
That's all I drink is water.
I mean, enough to keep, like if you eat something if I'll eat something, oh shit, I shouldn't have eaten that. Maybe it was something with pepper on it or something. I mean, I should start gulping water. I mean, I don't drink a liter of it or anything, but I probably drink a cup or two. And I keep, because I want, you've got to visualize, you want to flush that out of there.
Yeah. Oh, yeah.
You're going to be strong.
Right. Exactly.
And water keeps everything hydrated.
Right.
The body's made up of mostly water.
Yeah.
Yeah, I don't know where mine is. It's somewhere. I haven't used
anyway,
I haven't used it in
That's
about
just my
20
story.
years.
I don't
Good.
know.
Thanks for sharing. Really,
Well, I'm
really appreciate
I'm
it.
gonna order another one for myself, and I'm gonna
Yeah.
try that again.
Yeah. And see, revisit the old,
Mhm.
That's right.
Yeah.
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 Because
But there's hope for us, right? There's definitely hope. Not only, but
Absolutely. I'm a
Always.
firm believer.
Remember what Dr. Weiss says in his book. Western medicine fails a typical pelvic pain patient because doctors play in their sandbox.
absolutely.
You go to a urologist, they stay in the urinary tract. You go to a gastroenterologist, they stay in the bowel. Millions is the wrong word. I'm sure thousands of women have had completely inappropriate hysterectomies. I actually had somebody last week who was scheduled for a hysterectomy for her bladder pain. I was like, why are you doing that? She goes, well, it's just what they wanted. I'm like, no, removing your uterus is not going to change your bladder pain. What on earth is going on here? It's just
Well, they wanted to put some kind of device inside of me, that thing that, I don't know what it is.
InterStim, the neuromodulator. Yeah.
Yeah. And then I'm going to this naturopath doctor that he's touted. He teaches at the University of Washington and Bastyr here in Seattle, which is a naturopathic college. And he said that I had, and it was affecting my bladder, SIBO and leaky gut. So, I mean, there's another, chapter on all that. I mean, everybody I went to had something different to say.
I think that some of that new biome research is pointing to dysbiosis.
Well, I think my bowels aren't the way they used to be.
Yeah.
And when I don't want to be so gross to say, but when I have a bowel movement, sometimes I feel like things calm down in there.
Mm-hmm.
And then when I feel like that urge to go comes on, my bladder gets a little weird.
Well,
for me, it's opposite of that because I get the crosstalk going because when I have a bowel movement, the nerves get turned on and it's like, oh my God, so I have it coming from both areas. My bowels are fine. I mean,
it's all connected.
Yes, it is. And when I have the least little bowel, I mean, it comes out just fine. And then right at the end, I don't know if you know what I'm talking about, but right when you get to the end of the bowel movement, I can just feel everything just turn on in both areas, and that can be, for me, debilitating because you can't, it's like, oh my gosh, you've got it not only from the vaginal area or from the vulvar region, you've also got it coming from the
colon
area. Oh gosh, yes.
Yeah.
Yes.
Yeah.
So my question is,
okay,
I
Ariella,
have
what?
a question.
Yeah.
Because mine, I can say I have first I have a Hunner disease, and second, for me, it's like burning until I have bowel movement, and then it's gone totally. So I don't get. I don't have burning when I urinate. It's just bowel movement. And it don't make sense. I didn't drink 6 months coffee. It didn't make any difference if I drink coffee or not.
So
That's my question.
So Ariella, you're describing something that's very similar to something that I occasionally have, and it started in my 20s, when my IBS was really bad and I was having terrible bowel cramping. I would be reading on my couch back before we had iPads and all this sort of stuff. I would be reading books on my couch, and the bottom of my feet would start to tingle. And it was really strong. And I'd just be laying there going, what the hell is this? And then 10 minutes later, I'd have a bowel movement and the tingling goes away. And that's just because, your intestine is going right by these nerves. And if you happen to
Yeah.
have a hard piece of poop pushing in exactly the right way, it's going to hit the nerve and it's going to give you symptoms until it's gone. Once you poop it out, then it's gone and the nerve goes back. I always know for me that if my feet start to tingle, both of one or both, I'm going to be near a restroom within 10 minutes. The other thing that used to happen to me all the time, and it doesn't happen nearly as much, is that I would get this wave of nausea associated with having a bowel movement after the bowel movement. I would be kind of sick to my stomach for 5 or 10 minutes. Anybody ever have that?
That might be from like your vagus nerve
Yeah.
doing that, because that runs up into your stomach from that area.
That's what the
Yeah.
doctor said.
But what I had, I used to have this extreme pain. I used to sit in the bathroom for an hour and empty my stomach with a spasm, horrible spasm in my pelvic floor. And then my nutrition gave me this magnesium. One of the magnesium that work on the muscle, and I don't want to drink it, but for 3 months I don't have it at all. In the day I start this magnesium. So, and I do the low, how do you call it, for IBS, I keep pretty good food contain, you know, like the food map. Yeah, I follow the food map.
Interesting. Now,
And low oxtail, I call it, you know, like oxtail, you know, that you have the systematic and the other kind of food that you should keep down.
Hey, the FODMAP diet and the IC diet, when you go through them both, you barely have a handful of food that you're supposed to be able to eat. Because one cancels out the other. That's why I ignored the FODMAP. I said, okay, because they wanted me to go on. I said, I can't do this. Making me crazy.
I find if I eat the IC, can eat white bread, sugar, this, everything that makes you fat. Like
well, everything in
moderation. Yeah, but
everything in moderation.
I'm a binge eater. I'm a binge eater, so I have to be very careful not to eat white bread and vanilla ice cream.
I eat Cozy Jack rice pudding.
Oh, rice pudding's my savior.
No,
that's all I ever have for dessert.
I make my own rice pudding, and believe it or not, I don't put any sugar in it, and it tastes like paste. But
put a little bit of cinnamon on top of that, a little bit of milk in there. Good.
Yeah.
All right, now, John, you guys, John just came in. Hey, John, is there something that we can help you with?
Well, I wanted to go back to the TENS unit.
Yeah.
And I know that you showed the picture, and I could not see on my screen where to put the electrodes.
Okay. Let me do this again. So you would do it, you do 2 above your pubic bone, and then make a little arc and then put 2 by each hip bone. That's the way that that's what this physical therapist recommended. And let me see if I can find that picture again. Hold on one sec. I don't know, I tended to do, when I was using it for pain distraction. So I did it on the inside of my thigh. I would do it on planes flying. Just here, hold on. All right, come on now. Where is this picture?
It's coming, Joe. It'll be there. Yeah.
I know.
But I picked up one on Amazon. It's this TENS 7000 unit, which I think is one of the fairly popular ones.
Yeah.
And how much was that, John?
Oh, it was under $30. It was not expensive at all.
Oh, wow. Okay.
Yeah.
Here's the picture right here.
Okay.
So
I see.
It's basically along the bikini line.
Oh, okay.
So there's 4 patches, right?
Yeah.
4 patches. Yeah. 4 leads. Yeah. Mm-hmm.
Okay. Well,
I only have 2 leads.
I want to let you know I've been in pain all day, and I still am a little bit, and I did take my pain medicine, but just talking to you all, it makes me feel that I am definitely not alone. Oh, God. And I want to thank each and every one of you for meeting you today and telling me your stories because I don't feel alone anymore.
I never want to let you know that. Of course, I feel the same way, sweetie. You are not alone. How could we be? You have such a great family, IC family. You know what? It would be so nice if a majority of the people who are in the chat would get on Zoom and we would have just a plethora of faces. Right. It would be just so wonderful. You know what I mean?
A question I do have, Jill, is I tried to join. I've always been a part of it on Facebook, but I can't, when I go on the icnetwork.org, right?
Yeah.
I can't find out where to join so I can make a contribution and
go to the store.
Right.
You have to go to the store first.
So how do I put that in there to get there?
There's up in the main menu of, are you accessing it on a desktop computer or an iPhone?
iPhone. So
Okay.
It's all in all those things.
I know, and I'm working on the menus right now. I'm going to make them a lot smaller. I was working on that yesterday. Let me show you.
You can show me what it looks like.
I can. So here, hold on. So IC Network.
IC sales, right? Isn't it, Jill? I think.
Huh?
IC sales, isn't it?
Yeah, the website is the IC sales, but I wanted to hold on. I wanted to do it the way you would try to do it first.
Okay.
So here, hold on. Okay, come on, are you gonna load? Okay, so here is right on an iPhone, right?
Yeah.
Oh wait, no, that's the shop. Darn it! Come on. I don't want to be on the shop. I want to go to the main website. Hold on. Okay. Okay, so here's the main website on a cell phone.
Right.
Okay. And so you go to the hamburger, and the hamburger is this big menu, and it will open up the main link, and you're just going to go to the last one that says store.
Okay, you said hamburger?
Well, when you're on an iPhone or an iPad, the computer compresses the page. And so if you have a lot of links, it will hide them. And there will be 3 little lines that look like a hamburger, and that you click on that to see the links. So anyway, that takes you to our shop. This is the ITN shop. And then you're just going to go to the menu, shop by category, and you're going to see ICN memberships, IC Optimist Magazine, ICN donations, things like that. Okay.
And I can do that right on my Facebook page?
No, well, you have to go, you're going to be on the web. We don't collect any money through Facebook.
Okay, so I have to go under icnetwork.org.
Yeah.
Okay.
Yeah, and then just click on store.
Okay.
You have to go find the little hamburger underneath the logo where all the links are embedded, and then go to the store. And then when you get to the store, you're going to go to that hamburger and go to.
You're making me hungry.
I know. I know. Hey, John, did you have any other questions, hon? I know you wanted to know the settings of the TENS unit, and that's.
I suppose that's probably just some experimentation.
I just played around with it. You'll know when you go too high.
Yeah.
I think the other thing that I was going to say is, how do we get more men to participate in these sessions? Because that's probably the biggest problem that I have.
Right.
There's a lot that's similar, but there's some very, things that are specific to men that makes things a lot more difficult.
You're absolutely right. Our challenge, the challenge with men, I work with men every day now. I mean, the word is out for a guy. If you're having pelvic pain, call Jill. She will help. And so we get lots and lots of phone calls from men. And they read everything. They listen. They come and watch the videos.
But they don't say anything.
But they don't write and they don't say anything. Because they're under the perception that this is a woman's disease when in fact it's a pelvic pain syndrome. So I'm always working on it, Hun. I just know that we're always working on it, and we should have so I've got one person who's a gentleman, a very, very good friend of mine, who wants to start a podcast for men with pelvic pain, and he's asked me to partner with him, and I want to do that. So I'm always doing my best. It's hard. And then caring for my parents this year was so difficult. I just couldn't schedule everything.
Oh, yeah. I mean, I'm not kind of like casting blame or anything.
Oh, I know.
It's just so frustrating.
I know.
That,
I know.
you know, there's really, and I have a pretty bad case, but I really don't have, you know, male counterparts that I can.
Well, so one of the things that we could do, I'll make you this offer, maybe this fall, what we can do is I can set up and announce in a blast email a meeting just for men via Zoom so that guys can talk to each other. And I honestly, I have no freaking idea how many would come.
You'd be surprised.
We could get 5, we could get 2, we could get 50. Nobody's ever done that before. But if I brought in a speaker who specialized in men's issues, I think we would have a bigger draw. I want to start doing more hosted podcasts more hosted meetings where we've got the speaker, we've got me in a Zoom just like this, everybody else is watching, and then we can take questions. That's absolutely on my to-do list of things that I want to do. So
how long have you had it, John?
Since I was a child. My earliest memories, probably age 4 or 5, of having bladder pain, actually.
Did you fall or anything as a child?
You know,
Hard?
I'm sure I had the typical childhood, you know, accidents and bumps and bruises and such, but I don't know.
Yeah.
I mean, it can be something as simple as how you were toilet trained.
Mm-hmm.
If you wet the bed, were you beaten? I mean, there have been some massive parenting fails around continence and children who literally were forever scarred by the way they were treated because they were young and their bodies were. So anyway, that's context, but it's far more likely that you just fell on your tricycle really bad a couple of times, and that might have created a foundation for pelvic floor tension. We also,
No, I forgot to add.
Oh, I'm sorry. Go ahead.
I'll make it real quick. I forgot to add one little thing. This all started when my mom passed away, and then I had a really bad fall. I mean, I fell so hard that the right side of me just turned, my butt and leg and everything turned black.
Yeah.
And so this has also been thrown in the fishbowl. Pudendal nerve issues. And once that thing gets flared up, it intertwines in your pelvic floor like a snake.
Perfect way. Donna, what were you going to say?
I was going to ask John, you've had it for so long, John. Has it been cyclic for you? I mean, do you find that there have been times when it's been worse than others? I mean, is there a pattern, or is it just all over the place for you, John?
For a while it was cyclical, but now it's getting worse as I get older, and it's getting pretty bad.
How old are you, John? May I ask?
I'm 52.
Okay.
And yeah, in fact, I've been in an extended flare for quite a long time now. And you know, there may be some, and I do have very tight pelvic muscles too.
Okay.
As well. And it's.
Do you see a urologist?
Yes, I do.
And is he helping you?
Not as much as I would like. I'm in the area where it's kind of a urologist desert, so to speak.
Well, where do you live,
So-
may I ask, John? What state at least?
I live in Wisconsin.
Mm.
Are you doing
I live-
physical therapy, John?
Yeah, I was just gonna say that.
I have been off and on.
No, that's gotta be the number one thing. in my
Well,
book.
you know, I actually started physical therapy when it became a thing back in 2008 or 2009,
Mhm.
and did it. And I had to drive 125 miles one
Oh
day,
my.
Oh, yeah.
you know, to see a physical therapist. And there's one in town now that does it. My biggest problem is that, at least initially, most of the physical therapists would not do internal pelvic therapy on men. They would do it on women, but they were afraid to touch men. And that was a huge problem for me. And it still is. So anyway, I have a complicated story and I can talk for quite a while, but I don't want to take everyone's
I
time.
think that is really
No.
important.
It is.
I'm sorry you can't find someone.
John, please, can you share just a little bit of your story? I mean, you're the only male here, and I would be very interested in at least a little bit of your story, you know?
Yeah, I don't know if I want to do it all public. That's
I
Yeah,
got
we
you.
can do it.
No worries, no
Yeah.
worries.
Hey, so Missy came in, and I swear I did not let a Missy in. Missy, are you an IC patient?
No, but I had talked to you on the phone before.
Okay. Well, how can we help you, hun? Can I, do you want to turn your camera on?
But
Uh-oh, can't hear
It's
you.
going haywire.
first time using Zoom, I'm having it cuts me off when I try to put the camera on.
Okay, that's okay.
But
That's okay.
I was listening to you earlier. The research that you was talking about with the good and bad bacteria.
Yeah.
In my early 20s, I would get, they said, frequent UTIs, and the uronologist that I went to at that time said that my body did not produce enough good bacteria to fight the bad. But what they did at that time was put me on a low dose Bactrim antibiotic once a day, and that had seemed to help my issues. But now that I'm getting older, of course, they don't give the antibiotics no more. But I am perimenopause, and so I had an appointment with a uronologist in Nashville, and they canceled my appointment because I'm also having issues with vulva pain and all that. So they said that they didn't think that I had IC, but they never looked at me. They were just going off of what the doctor's report said. But I'm having burning when I urinate. I mean, it's after I urinate and when I wipe, but I'm on a hormone patch.
Okay, but where?
And so,
But wait. Okay, so you have burning after you're done urinating. Is it on your skin, on the outside of your body, or is it burning inside of your body?
well, it feels like both.
Okay.
Sometimes it feels on the inside, and sometimes it feels like it's on the outside.
Okay.
I've been dealing with it since December, and I do have a appointment with a vulva specialist, but it's not till September. But it's just I don't know if it's bladder related. I don't,
No,
but I do.
that's not bladder related. What you're describing is vulvodynia / estrogen atrophy.
Okay, they tried the cream with me, and they have put me on a hormone patch, but discontinued the cream.
Why did they discontinue the cream?
I'm not sure, but I see my gynecologist this month on the 27th, so I may ask her if I need to start using that cream again. But I didn't know if it was bladder related because I'm having burning afterwards, and
No, that just means that your skin has lost its ability to defend itself because of aging. And so any chemical that touches that skin is going to cause a burning sensation, We call that urine burn. And what you can do that's very helpful, let me get it here real quick. Whoops, hold on, my microphone is stuck there. Is we have in the IC Network store under restroom supplies this Perry bottle. It's like $4. You fill it up with water,
Okay.
just room temperature water. Every time you pee, as you're peeing or after you're done, rinse yourself off with water, because water will get all the irritating chemicals off of your skin. And then you pat dry with toilet paper, but toilet paper will not get all the chemicals off. Water will. Don't put anything in it. It's just plain water. This is the remedy for urine burn for everybody. And I learned this in the 80s from a vulvodynia support group. And if anything I ever did, this is what helped my vulvodynia the most, was just getting the chemicals off of my skin so it wasn't irritating the nerves. Okay. So that's in the ICN shop, and it's under restroom supplies.
Okay.
But so when you go to the gynecologist, you need to have them look at the quality and health of your skin down there. Because if your vulva is dry and your vagina is dry, so is your urethra and so is your bladder, and they're all estrogen dependent. And that the classic sign of estrogen atrophy is urine burn, and that's exactly what you're describing, is urine burn. Okay.
Okay. But you can take.
You can what? We lost your audio, hon.
Yes, I'm sorry. I'm having trouble with my phone.
Okay, that's okay. That's okay. Well, if you want, you can call later. Hey guys, listen, we've been going on for some time. We had a message over here in Facebook. So let's see. Hold on. And I'm screen sharing. So let's see here. Sharon wrote, oh, Peggy had to leave. Not a problem, Peggy. Mine is in layers too. Botch mesh, cut my urethra in half, IC, pelvic floor dysfunction, pudendal neuralgia, and entrapment, plus loss of estrogen, burning bladder, burning vagina, in a flare at the moment. I try to tell people that my redheaded genetics also play a role in my pain, causing Sjogren's and chronic regional pain syndrome. Redheaded sensitivity, redheaded absolutely process pain very, very differently. We do. Something triggers the nerves to push and pull, twist and tug, twist and burn. Related to her bowel, she has a rectocele. Years ago, I felt like something had kicked me in the groin. It would wake me up so bad. Waves of nausea. Started after my last big baby. She weighed 9 pounds. Sickening pain. Still happens occasionally. That's a birth injury, hon. Absolutely a birth injury. Linda asked, would Flomax help John? John, did your doctor give you Flomax?
Well, I've tried it in the past, and sometimes it will help, but Flomax has some side effects that can be unpleasant.
Yeah.
And I get those, and so yeah, I have a lot of urethral burning.
Okay. See, John, I think that it would be, whenever symptoms start in childhood, we're really always trying to understand anatomy a little bit more. And I really have to wonder if you have like an abnormality with a hip, or like, is your tailbone in the right position? I think it would be, I think I shared the study 2 years ago. 70% of the men struggling with pelvic pain and diagnosed with chronic prostatitis, 70% of those men actually had a hip problem. Like, are you pigeon-toed or duck-footed?
No, but I have extremely flat feet.
Oh,
Like
that.
I have no arch whatsoever on either one of my feet.
So, and have you read the chapter on feet in Jerome Weiss's book, Breaking Through Chronic Pelvic Pain?
Yes, I don't think I have what's the toe called?
The
I don't have that.
Morton's toe.
I
Morton's
don't
toe.
have that.
Yeah.
But putting trying to get arch support actually hurts my feet
Yeah.
because they're used to being flat. So
Did you ever go to a podiatrist? Did they ever try to make an orthotic for you?
yes, and I have a hard orthotic which hurts so much that I just can't use it, and I have a soft orthotic which is marginally better. But yes, I have tried that as well.
And when you did pelvic floor work, did your muscles always lock back down into tension, or did your muscles slowly improve over time?
They would always improve until the therapy was stopped, and then they tightened back up.
I think it's your feet.
No, that could be.
I think it's your feet. I mean, that would be such a great question for a physical therapist, just to try to understand the dynamics of what happens to muscles when you have really flat feet.
I have flat feet too.
Do you really?
Yeah, I do. And alignment is a big deal with flat feet. At least I found that to be when I went to my pelvic floor physical therapist and to the podiatrist. You're always trying to get that flat foot to you're always trying to get my right side is worse than my left side, and my right side, you can tell when I stand in the mirror, it's off a little bit because my foot it's flat, so it goes inward. Is that what I want to say? It goes in and out, and so you can just tell my whole leg is out of alignment, everything. And so I wear Bionics, which has a softer arch support. And that does put me back into somewhat of alignment. Like I don't walk barefoot in the house. I do have my Bionics. I used to wear Birkenstocks, but then that got that's a bit harder. And so when I went to the podiatrist, Bionics was something that they did recommend. And I do have an orthotic as well. That's a soft orthotic. But yeah, you're totally that one side is out of alignment for sure.
Yeah. Well, I mean, it would just be very interesting, I think, to study your hips a little bit more, and your feet and how they connect to your hips and your pelvis. It would be fascinating to see that. So, all right, guys. Well, listen, I'm going to shut down the Zoom. Thank you so much for coming in, Dawn. It was wonderful to see you, John. Thank you so much for coming in. For everybody else who came in, because it's getting hotter and hotter here. And so let me go back to Facebook and YouTube briefly, and we will be saying goodbye for the day. Okay?
See ya.
See ya. I love you, Donna. You are just my sister.
I know, baby. I know. We could do this all day, right?
We could. I really wish we were close.
I
We
know.
would be hanging out all the time.
I know it. I said one of these days, and I told you that I'm going to be well enough to come and visit you, and I'm going to do that, and that's on my bucket list for sure.
Yep. All right. Okay, honey. I'll see you later.
Love you.
All right. I am back now on Facebook. And let me go here. Sorry about that, guys. Hold on. Testing 1 2 3. Testing 1 2 3. Okay, we are back. Oh, my lips look all weird. All right, you guys. Danielle says I relate to what she's saying. I'm on cream, but again, until I take 70 milligrams of methadone and wait an hour for the excruciating pain. Yeah, so hard. Well, you guys, remember your strength. You're here because you're strong. You're here because you don't give up. You have never been more prepared to deal with whatever happens to you than you are at this very moment, because you are truly older and truly wiser. Linda says, I have Morton's toe. What do they do for that? You actually put a little tiny circle of what do you call that? Oh, come on, I have it in my bedroom. It's something that you can put on your insole that will just lift, that will just protect. See the problem with Morton's toe. Here's the problems with Morton's toe. The way the human body is designed is the biggest bones are supposed to carry the most weight. So normally when you walk and you put weight on your foot, your big toe carries 70% of the weight. The second toe carries 20% of the weight, and the rest of the toes basically carry no weight. I mean, maybe 5%. So the correct mechanics for walking is the big toe carries the most weight. The problem, of course, is that when you have Morton's toe, your second toe is longer than your first toe. And so your second toe hits the ground first. And it ends up carrying, so you basically bypass the big toe for carrying weight. The second toe carries the bulk of the weight along with the other toes. And that's why people develop toes that curl in. If your toes are curling in, then that means that your weight is not distributed correctly. And I can show you a picture of this. And it was Dr. Weiss in this book, Breaking Through Chronic Pelvic Pain, that really helped us turn to feet and what's going on with the feet and how something like Morton's toe can cause long-term pelvic floor tension and dysfunction. Okay, so here's a picture. So here's your big toe and here's your second toe, but you can see the bone is longer than this toe. And so that's going to now allow the weight to get carried on that second toe. And so he says here, the first metatarsal must be at least as long as the second metatarsal in order to work properly. When the first metatarsal bone is shorter, it can't do its job of absorbing the stress on the forefoot from walking, standing, and pushing away from the ground. In a perfect situation, Mother Nature makes the first toe as long or longer than the second, which allows it to carry twice the weight of the second metatarsal. If the first toe is shorter than the second, when you take a step, the second toe meets the ground before the first one does. This then blocks the first toe from doing its job of supporting most of the weight. The second toe must now absorb the weight of the first share of the first toe, doing 100% of the work instead of the usual 33% of the work. And this is an even better picture. See that? That's a perfect example of Morton's toe right there. And so what you do, I have Morton's toe too, is you do a little tiny toe pad. And I have this in all my shoes. I just cut a little circle of, oh, come on, what the hell is it called? Hold on. It's made of, oh, come on, it's that fabric you put down that's sticky. Hold on, I've got it in my bedroom. Oh my God, it's just right on the tip of my tongue. Moleskin. I remembered. It's called moleskin. Moleskin. And it's very thin. It's like 1/4 of an inch, sticky. You just cut a circle there and you put it underneath where your big toe fits. Let me go get one of my shoes and I can show it to you. Okay, so I have my beloved Hokas. Love these shoes. Just ordered another pair. I go through these shoes so quickly. Okay. So there it is right there. So when you put this underneath the big toe, it makes sure that the big toe hits the ground first. Super, super easy. Okay. It's about, it's maybe not quite 2 inches, maybe 1.5 inches round. Okie dokie artichoke. So if you want to learn more about that, come on over to the IC Network website and get this book, Breaking Through Chronic Pelvic Pain. All right, my friends. Well, I think I'm done. My voice, my throat's starting to hurt, which means I've talked enough. Danielle says I've always had flat feet. Very frustrating to try to get on here, but I can't. Oh, honey, you're okay. So I'm going to say goodbye. I will see you next weekend, and you can always call during the week. I have Mondays off. Tuesday's the 4th of July, so don't bother on Tuesday. But I'll be here Wednesday, Thursday, Friday. Knock on wood. Knock on wood. And no fires. I'd be happy to talk with you by phone. And if you find these meetings helpful, please become a member of the IC Network so you can get our magazine, The IC Optimist, and that helps me do these meetings. All right? All right, guys, I will see you later. I'm going to say goodbye to YouTube. Bye, YouTube.